First of all, I would like to welcome you all to the national webinar that we have organized on UG-PG program and careers in psychology. And thank you so much for being part of this program. We'll start with our director sir's brief session. He'll start with a welcome address. So I would like to call our director sir, who is an esteemed academician and distinguished personality in the field of psychology. And he is a highly qualified professional, and he is also a part of our Dean of Student Welfare. I hope I'm audible.
Yes. Please go ahead.
Sir,
Go ahead.
sir, am I clearly audible?
Yes.
Yes. Okay, so sir is also a part of Dean. He is a Dean of Student Welfare program that we have in our organization. So he's helping so many students in that way as well, and his contribution in the field is very appreciable. Okay, sir, I would like to call you to give a brief.
Okay. Good afternoon to all of you. I'm Dr. Gautam Gauli here. I'm professor and director of Amity Institute of Behavioral and Allied Sciences. Yeah. Hello, am I audible? Am I audible to you?
Yes, sir, you are.
Okay. So good afternoon to all of you present here for this national webinar. Yeah, good evening. So the national webinar being a national webinar being organized by Amity Institute of Behavioral Sciences, Amity University, Mumbai. On behalf of our institute, I welcome you all for this national webinar, which we have organized today, and we have very esteemed speaker in this webinar. We have Senior Professor M.E.R. Raju, who is a professor of psychology from Andhra University. He is also a president of our one of our very old professional organization called Indian Academy of Applied Psychology. So I'm very happy to have Professor Raju here with us. He is one of the authority of psychology in our country. We have another very esteemed scholar and well-known personality in the field of psychology, Professor Yasham Khan, who is a professor of psychology from Aligarh Muslim University. And he is, of course, well known by his work, and he is with us as one of the speakers in this webinar. We also have another speakers like Dr. Prida. She is joining from Goa. Then we have Shubhankar joining from Hyderabad. So they will be introduced to you. Anyone, Dr. Anjali joining from Guwahati. So they will be formally introduced by Miss Anjali, my colleague in IBAS, Amity Institute of Behavioral and Allied Sciences. And all my colleagues are here. Some of our students also have joined this webinar. And I, on behalf of Institute again, welcome students, those who are joining from Bangalore, Kerala, Andhra Pradesh, the rest of Maharashtra, Nagpur, Mumbai, of course, Delhi, Guwahati. Okay, so there are many students joining from various parts. I could see here we have the number is increasing. We have around reaching 300 students, and they will be joining our webinar. Now, this particular topic which we have opted today, that we just wanted, because many of our students, they wanted to enter in the field of psychology since last 2-3 years, when we experienced COVID-19 in our country and the whole world, of course. And there we realized that there were two professionals were very busy, and these professional physicians and psychologists. And during this COVID-19, whole world was expecting that there should be some psychological interventions to deal with this COVID situation, because many people, due to COVID and due to fear of COVID, many people have lost their life. And during this time, of course, I mean, psychologists were very active. All mental health professionals were very active in dealing with this kind of crisis, which we had in 2019, 20, and some part of 21 also, right? And during this time, people realized, even students, young students, those who are studying in 12th standard, and even those who have completed their BA or BSc in psychology, they were all interested in entering this field because they realized the importance of this psychological services, right? And keeping this thing in mind, the needs of our youngsters, so we have kept this webinar to solve their difficulties, problem which they face, and they also wanted to know how to enter in the field of psychology, right? So I would like to just give few tips to students. First, when we choose any career, like this is not only for psychology but even non-psychology people also. When you choose career, we have to keep in mind two things. One is that you must define ourselves first. What I am. Now, what I am in terms of our aptitude, our intelligence, our general mental ability, our interest pattern, okay, and personality characteristics. This is what we call what I am. So that needs to be defined. That our self definition has to be, first we should understand ourselves first, define ourselves first, and for defining ourselves, also we require psychologist help. But we have to approach psychologists. They will involve themselves in your psychological assessment, and after assessment, they will provide you scientific information which help us to define ourselves. Once we define ourselves, then we look for a place or word of work where your self can be expressed. And that's why we need other information about word of work. And word of work is very complicated. Word of work is beyond common man's comprehension. There also we required experts' help that how to understand word of work. So once we understand ourselves and understand word of work, okay, particularly in the field of psychology, right? So it becomes very easy for us to take decision. So which particular field or which subfield of psychology will I be more suitable? So this kind of question, which many of you, all participant, young students, must be asking yourself, that how to develop career in field of psychology. And there are many institutes providing educational facilities. Amity Institute of Behavioral Allied Sciences is one of them. Okay, so this we thought that, I mean, by assessing the needs of our students, those who have recently passed out well standard, or those who have recently passed out their graduation, so they are in need of information. Without information, they cannot plan their career. Okay, so for planning career or anything which you plan, we need information. So career guidance and counseling is another very scientific information will be provided to you. So which will definitely help you to take appropriate decision about your career, particularly in the field of psychology. So without taking much of your time, I would like to invite, because we have invited very renowned personalities in the field of psychology. They will be sharing their own experience. They will be providing, because they have been instrumental in developing many students, their research, developing in their development in their career. The role which these people have played is very important. So even if they share their experience with you, I am sure that this is going to be very important for you to take appropriate decision before you enter in any educational field, including psychology, right? So I will invite Professor Raju to deliver his talk on psychology as a career. He has been given a specific topic because he has been constantly working in spirituality, yoga. He has been working stress management, organizational behavior. These are these are some of the very interesting topic which he has been consistently working in this field, and I'm sure that his interaction with all of you is going to be beneficial. So over to Professor Raju. Can go ahead with.
Okay, good afternoon, sir.
Yeah, good afternoon. Good afternoon. Please go ahead.
Yes. Please go ahead. Most respected dignitaries, my good friend, my well-wisher, Professor Gautam Gawali, Director and Head of Department of Psychology, AMT University. Respected speakers and dear participants, it's my privilege to share my teaching, research, and clinical experience. That today is my topic is careers in counseling, spirituality, and beyond. Very briefly, I will explain the concept of counseling psychology. See, counseling is a health service specialty in professional psychology that uses a broad range of culturally informed and culturally sensitive practices
Hello, sir. Sir, your voice is lagging.
And elevate distress and maladjustment, resolve crisis in their lives. So it's audible? Am I audible?
Clearly, Professor Raju, you are not very audible.
It's not audible.
Yeah, there's some connectivity issue. Yeah. Punitji, can you help Professor Raju?
Your voice.
So he can switch off his camera then speak. Otherwise,
Switch off camera, right? Okay.
Okay, it's audible, sir. Am I audible?
Yes. You are audible now. Yeah, please go ahead.
Yes, please. Okay. You're all aware, according to WHO, the second highest disease in the world, depression. That today, 50% of the Indian population have been suffering with depression. Number two, suicide rate is also very, very high in India, especially some of the north states. When we're coming into the south, Andhra Pradesh, Telangana, suicide rate is very high. One is the farmers, number two, weavers, number three, adolescents. So in view of the suicide rate and the depression, psychology plays a vital role among depression patients. The counseling psychology speaks, it's a professional psychology that uses a broad range of culturally informed and culturally sensitive practices to help people improve their well-being. This is very, very important. In every state have their own culture is there. And also we have different cultures in our country, different languages is there. Apart from that, day by day, acculturization is increasing in our country. So today, divorce rate is also increasing in our country. And when you're talking about an industry, interpersonal relations is increasing in between superior and subordinates and peers. Most of the public sectors day by day sinking due to interpersonal conflicts, the stress, and other family problems in industries. When you're talking about the schools, in the schools, today, when we see Indian statistics, the 10% of 10% millions suffering in disabilities include ADHD, autism, MR, intellectual disability, learning disabilities, and other disabilities. Apart from that, when we see unemployment is also increasing, 240,000 people every year migrating to the Western countries for the employment. This is also one of the burning issue in our country. So when we're talking about the counseling psychology, it plays a vital role. One is the well-being. Number two, prevent and elevate the distress. And those who are suffering with maladjustment problems, resolving their crisis. Apart from that, increase their ability to function better in their lives. That's what counseling psychology speaks. Coming into career counseling. What do you mean the career counseling? A career in counseling psychology involves providing guidance, support, and therapeutic interventions to improve clients' well-being and quality of life. The guidance is very, very important. What I have seen in public sectors, when the student, the qualified, the GATE examination, the qualified NET examination, when he's appearing for an interview, most of the students is not aware about their own self. They're not aware their personality, their attitude, and interpersonal relations, and also lacking communication skills. Apart from that, the English speaking skills. So being a counseling psychologist or therapist, guiding the students in a proper way, how to face the interviews, the way they dress up, the way they're sitting in interview board, the way they're delivering the answer to the interview board members. This is one of the important. And second important guidance, students, without seeing their own ability, they are not choosing their proper careers. They're writing entrance examinations. They're getting admissions, either BTech or MTech or MSc. So with their own interest, they're joining. With the guidance, they will succeed their professionals. Lack of proper support. This lack of support from the parents, the family members, the peer group, the teachers, and also society. So the career counseling speaks, the guidance plays a vital role, and proper support is more important for choosing the course, basic UG course and PG course. And also the career counseling psychology, motivating the students, and they conduct psychometric tests. Through psychometric tests, identifying their ability, their knowledge, their learning skills, their cognitive skills, their emotions, and guiding and supporting the students. Apart from that, giving therapeutic interventions. We have different varieties of scientifically proved psychological interventions. It's available and across the country and outside the country. These interventions to improve clients, their well-being, and their quality of life. See, just I will explain very briefly what are the interventions available. These interventions we are using in counseling settings. The number one is the counseling. Individual counseling is there, group counseling is there, couple counseling is there, and psychotherapy, cognitive therapy, behavior therapy, behavior modification, learning theories. Each learning theories plays a vital role in the counseling process. Use mental imagery, auto suggestions, learn progressive techniques, visualization therapy, muscle relaxation techniques, the Indian concept, meditation, transcendental meditation is also there. It is called as a mantra. Different yoga asanas is there, the role play and management training programs. Techniques very, very useful to motivate or to elevate their personal, social, educational, family problems. Here are some common careers in counseling psychology. We will discuss one by one very briefly. When we talk, we're beginning, we talk with clinical psychologists and the counselor. Normally, clinical psychologists, a counselor having MPhil, clinical psychology, and PhD in clinical psychology. So clinical psychologists, the role of the clinical psychologist, mental health professional specialized in diagnosing, treating psychological and emotional issues through therapeutic interventions and the counseling. We have different diagnostics is available in clinical settings, personal appearance and behavior. The speech is there, communication skills is there, attitude of the client, So apart from that, diagnosing about previous history, the family history, friendship, relations. Suppose the child studying in a school or the college, we will diagnose school relations, the teacher and student relations. Not only this, the today, see, diversity is increasing, especially software employees. I conduct a number of studies and also I publish with my research experiences, the drastically increasing the diversity in our country. In every district, having 3 family courts. In every year, we have earlier, we had only 1 family court. So earlier, in any diverse case is coming to the family court, minimum 6 months time, they refer to the psychologist for counseling. But today, they are not referring to the psychologist, the court itself giving divorce. So, due to interpersonal relations, family problems, job related, the financial related, sexual related, the misunderstandings, eating habits, mother-in-law problems. These are all some of the major problems in the husband. So the clinical psychologists are counselors diagnosing those people and treating psychological. Already I mentioned the number of interventions according to the problem, which intervention is suitable to the particular situation or particular problem. The psychologists identifying, applying a specific psychological intervention and also emotional issues through coming into counseling psychologists. See, counseling psychologists, if who focus on providing therapy and support to individuals, helping them cope with emotional challenges and improve their overall well-being. Overall, their well-being. This is very, very important right now. See, the therapists and support to individuals helping. What type of support? Say, about the career, about the studies, about the subject, about the language, about the communication skills, or a dropout, or any other family problems. If the child suffering with single parent, or wife and husband have a problem, sometimes their emotions, their behavior directly influence to the child. The child is behaving in the society. Not only this, the drug addiction rate is increasing in across the country. And today, what I have seen in my research in Visakhapatnam, day by day, the drug rate is increasing. Drug abuse, smoking, alcohol, LSD, marijuana, that is called as weed. So, not only general students, what I have seen, engineering graduates, some of the doctors habituated to these drugs. So young students, those who are entering into the MBBS, those who are entering into the engineering graduates. So due to number of problems, maybe financial, maybe the family, or single parent, or a love affair, or love failure, or sexual related, and so on. So what I'm saying here, counseling psychologists will help, okay, improve their overall well-being. Coming into the third one, school counselor, an educational professional who works with the students, the teachers, and the parents to address academic, the social, and emotional needs, fostering a positive and supportive environment. So day by day, public sector, private schools are increasing. Lot of difference in between public sectors and private sector schools. About the teaching, about the community schools, the school environment, culture, okay, and social status, the caste, they plays the vital role in the schools. We know pretty well. We have a lot of previous experience also is there. So what I am saying, school psychologists identifying their problems through psychometric tests and personal interviews, and also personal interview with the students, our children, our parents, and the school's teachers. And positive and support school environment provides to the students. Coming into the marriage and family therapist, the role of the marriage and family therapist. A specialized mental health professional who helps couples and families resolve the conflicts, improve communication, and strengthen their relationships through therapeutic interventions. What I have seen, for example, in the South, our Gujarati lady, so they wear the saris. That today, so when we had a nuclear family, okay, they're well educated, good social status, and social class. Now, the dress code is also changing. So, when the husband is not accepting, the problems are started. And the wife and husband, suppose when the wife and husband are employees, they're coming too late, different timings. For example, software employees, the wife working in the daytime, husband working in the night time. Different shifts is there. Who comes early? Who prepare the food? Who taking care of the children? Okay, these are all some of the issues I'm mentioning in the family and also the marriages. The earlier joint family system, arranged marriage is there. The today love marriages and also living together is also is there. These are also plays a vital role in between the wife and husband. So as a family therapist or counselor provides or improve or decreasing the family conflicts, resolving the family conflicts, improving their communications, improve their communications in between the wife and husband, about their personality, about their attitude, about their emotions, their aspirations, and also expectations, identifying their strengths and weaknesses and encouraging their strengths and identify their weaknesses, and will provide the counseling. With providing through counseling, they're coming to inside. Through inside, they think about the minus points. Okay, this is one of the important therapeutic interventions in marriage and therapist. Coming into substance abuse counselors, a professional who provides the support, the guidance, and treatment to individuals struggling with drug or alcohol addiction. We have aversion therapy is there. Biofeedback, we are using biofeedback in my clinic, and also awareness programs in Andhra Pradesh, the whole Andhra Pradesh, with support of the police department and psychology department together, conducting number of awareness programs in every medical college, engineering colleges, and degree colleges. This is very useful for
Anjali, yeah.
Yes, sir. Yes, sir. So there is some network issue from service.
Okay, so I have already requested Professor Raju to conclude. Okay, am I audible to you?
Yes, sir. Yes, sir. You're audible.
Yeah, I think there's a technical glitch, some internet connectivity with Professor Raju. Okay, Professor Raju has covered many aspects of counseling psychology as a career. There are some questions which we will be answering this question at the end. Okay, so I have noted down the question raised in question answer box. Okay, so now I think we can start further. Ms. Anjali, you can go ahead with the other resource person.
Yes, sir. Yes, sir.
You can formally introduce.
Yes. Now, I would like to call Professor Dr. S.M. Khan from Aligarh University. Sir have years of experience in academics and is now a professor of Aligarh Muslim University. His commitment and knowledge to in the field is excellent, and we would like to hear from him what kind of experience he have and share his insightful knowledge about the session with our students and with the students. Sir, I'll share yours. Okay.
Thank you so much, sir. I hope I am audible.
Yes, yes.
Yes,
You
sir,
are.
you are clearly audible.
Thank you, sir. Thank you so much, Professor Gawali, sir, and your team for giving me this opportunity to share my talk, sir. We have been associated for almost 20 years plus. बहुत सारी चीजें आपसे सीखी हैं, sir. I will be at your expectations. As rightly said by Professor Gawali in the beginning, friends, there is a need to know about own self. Who am I? Before starting your journey, you must ask this question, who am I? Almost 3 decades experience, I used to ask this question to my students in workshop. Can you define yourself in a single word? Who am I? Hardly 2 to 3% used to answer this question. Can you, Anjali, मेरा video off करेंगे आप please? Okay, fine. So wonderful point, friends. You need to ask this question, who am I? In this direction, management guru, Johari, very popular model, Johari Windows, they suggested a model to know about yourself. He divided a circle into the 4 quadrants, and he labeled as open self. The things are open to you and things are open to others. Second quadrant, blind self. Things are known to you, but not others. Third, hidden self. Things are known to others, but not known to you. And the last one, unknown self. There are many things which are not known to you and not known to others. Friends, this can start your career in a very wonderful way if you work on all these 3-4 quadrants. The teachers can help you, the psychologists can help you, the professionals can help you, the parents can help you to enrich your 4 quadrants. So this is one of the messages that I wish to share with you. Moving towards my talk, I'm sure a number of participants are joining from different psychology background. If one slide, friends, as a psychologist, you know, this discipline help in academics and applied study of mental process and behavior. When you are interested to know about your mental well-being or how you think, how you behave, how you react, how you are down with number of emotions, then there is a need to go for psychologist. And this is a wonderful discipline which is being used almost in all discipline. So psychology also involves the application of knowledge to various spheres, human activity, daily life, work and family, to the treatment of severe mental health problems, as has been debated by Professor Raju in his talk. Number of spheres are there where a psychology can help you. So the question before us or before you as a career aspirant, why psychology? There are a number of disciplines. So you need to answer this question, friends. If you are interested to want to learn about the behavior of people and human mind, there is a paradigm shift. Before considering an individual to the admission to a course, we are having number of test batteries. Before deciding a boy or girl for the marriage, we are having number of months or weeks or years to decide a boy or girl. So this is the paradigm. Before taking a decision, we want to judge number of alternatives or options that you have. So the psychology is there. Why do people react to certain things in a certain ways? If you look into the boys, if you look into the girls, they are similar in many ways, but they are different. They are unique. So diversity is there, so issues will be there. Then there is a need to look into how to manage these emotions, behaviors, and reactions. Whatever the domain it may be a family, it may be a workplace, it may be a society. We need to connect to each other. Before connection, there is a need to learn about others, what they are expecting from us. My spouse, what she is expecting from me, how I am expecting from her. So these all issues are in the domain of the psychology. So learning psychology will teach you all about the behavior of people and how their minds work, which can useful everywhere. When I say everywhere, in every domain of the sphere. If you look into the branches of psychology, American Psychological Association had 54 divisions, 54 branches. Each division represents a specific area of interest within the field of psychology. You can choose it as per your interest and chase your career. Friends, जिंदगी अल्लाह ताला की ऐसी नियामत है, you need to enjoy it. ये दोबारा नहीं मिलने वाली है. You need to enjoy it. And you can only enjoy when you learn or when you are familiar about yourself, what you are expecting from your life. So these are the 54 divisions. The slides will be with you, with the organizers. I will share with you. You can go through each and every division and try.
Sir, sorry to disturb you, but your slides are not changing.
Not changing?
No, it is not changing.
Not yet?
No, sir.
Okay, let me do it once more. Is it now?
Yes.
Yes, sir. It's changing.
Now?
Yes.
Fine,
Now
fine.
it's
Thank you so much. So 54 divisions that you can go through and try to fit yourself where you can chase your career. Different, as suggested by the American Psychological Association. So unlimited opportunities are there for a psychologist. 54. Friends, as the program is related to the behavioral sciences, Professor Goali has decided to talk about the behavioral sciences. Thank you so much for choosing this topic, sir. Friends, as I have been working with the Indian Railways almost 23 years, and working with the different type of groups and bosses. And I decided to go for the academics and help my students to develop yourself to be at the expectation of the bosses. So behavioral sciences, the study of human behavior and the factors that influence it. If you are familiar this domain, if you can work on this domain, so trust me, you will be successful with your bosses, you will be successful with the subordinates, with the bosses and employer as well. So behavioral sciences can help you to explore the ways in which individual and groups act, think, and interact. Very interesting domain of the science. Behavioral scientist seeks to understand factors that influence behavior. Why my subordinate is not following my directions? Why my dependent are not following my instructions? So there is a need to look into. Then cognitive process, why they are thinking in a different way. Social and cultural norms, we are from the traditional families. We need to follow a number of norms, keeping in consideration a prior about the norms. We need to be successful at the workplace also. Environmental influences and diversity. So the behavioral sciences knowledge can be applied to various fields, mental health, promoting behavioral change. किस कदर देखिए सोसाइटी में अप एंड डाउन्स हैं. Whenever there is a change, बहुत सारे challenges होते हैं that you need to look into it. Optimizing organizational dynamics. Organizations are changing. Organizations are boundaryless nowadays, so as to address the societal issues. The scope of behavioral sciences, psychology. If you are choosing the psychology as the domain for the behavioral sciences, then it can help you to individual behaviors, cognition, emotions, and mental process. The areas include personality, learning, memory, perception, motivation, and mental health. Very interesting domain. Initially, I was a statistician. I did masters in statistics. And later on, I switched to the psychology. I was able to relate numbers to the qualitative domain of the thinking process. Psychology. Sociology, again, the behavioral sciences. I'm discussing the scope of behavioral sciences in different disciplines. If you are from the sociology, social behavior, social structures, institutions, group dynamics, and impact of society of the individual behavior. Anthropology, the human cultures and societies, social factors shape behavior. Economics, organizational behavior, the study of the behavior within the organizations, how to work with the team, how to seek employee motivation, job satisfaction, organization culture. We need to follow these. Next point, friends, public health and health behavior comes in the paradigm of behavioral sciences. The study of health related behaviors, health promotion, disease prevention, as Dr. Raji rightly said about the pandemic. Psychology is there. Consumer behavior, the study of consumer decision making comes under the paradigm of behavioral sciences. Criminology, criminal behavior, criminal prevention.
Yeah, Professor, your slides, please change the slide. Stuck on this third slide only. Yeah, okay.
Now it is okay, sir?
Yes, we are on.
Fine. So I will not run the slide. I hope this is the right approach. Fine, sir. So the political science, again in the paradigm of the behavioral sciences, the study of political behavior, voting pattern, public opinion, psychologist is there, psychology is there, behavioral science is there, applied behavioral analysis, the application of behavioral science, principles to modify and shape behavior, therapy, and organizational management. So after discussing the scope of the behavioral sciences, friends, I decided to discuss some of the major disciplines of the psychology. If you are interested to specialization in general psychology, then you need to seek masters or and PhD in psychology. And general psychology will help you to know about fundamental principles, theories, and concepts of the human behavior and mental process. Higher studies in the general psychology provide individuals with the knowledge and skills needed to conduct research, analyze data, understand human behavior, and contribute to the field of psychology. The career path: research psychologist, academic professors or consultant. Number of universities and research institutes and healthcare facilities are looking forward to appoint the individuals from the general psychology. And training in a specific area of psychology through postdoctoral or doctoral degree will help you the added advantage. So this is one of the domain. If you are interested to seek the career in general psychology, then number of careers are there. Developmental psychology, friends, encompasses various stages of development, including prenatal, infancy, childhood, adolescence, adulthood, and aging. Friends, we all have passed these stages. Perhaps when we were infant, we were not familiar about different practices. Now we are familiar. So as a parents, as a guardian, as a teacher, we can inculcate, we can take care of these issues in our students, in our dependents, in our subordinates, so they can be familiar about their different developmental process. So this knowledge will help you how lifespan and the skills needed to conduct a research. Very interesting domain. The higher study program includes advanced coursework in areas such as cognitive development, social development, lifespan development, and research method. Career path: researcher, academic professor, applied settings in schools. Almost in all the schools, the government is planning or have planned to recruit the psychologists in this domain, special child class. So this is one of the beauty of this domain. Experimental psychology, friends, this help you to uncover the underlying causes. Why my subordinate is not following directions? Why my subordinate is not motivated? So this is the reason that help you to examine the cause and effect. We used to say my subordinate is not motivated. My dependents are not motivated. But this is not the correct interpretation of the behavior. In fact, my subordinate are motivated. My dependents are motivated, but in the direction in which I am not interested to see them. So direction is very important. If your dependent are not following your instructions, then something in between you and him or her. So there is a need to work on the direction. Win-win scenario तैयार करना है. If you are so aggressive, the dependent will be making a distance. If you are not taking care of the citizenship behavior of the subordinates, they will not respect you. So this is the domain that you need to learn how to examine the cause and effect. Again, unlimited careers are there in the experimental psychology. Cognitive psychology, friends, it helps you to focus on mental process, including how people think, perceive, remember, and problem solve. A number of disciplines are there. You can go for the specialization in your doctoral program or postdoctoral program.
Yes.
Career path, unlimited career. Psychologists, academic professors, consultants. They may find employment in universities, research institutions, government agencies, or private organizations. Cognitive psychology. Almost all the IITs are having humanities, and they have developed the lab for psychophysiological assessment. Then you can capture the brain waves and neurons and examine how an individual is acting, how the brain waves are acting in reference to the different emotions. You can help the society, you can help yourself. Social psychology, I have included some of the very important disciplines which are not, I suppose, are going to be covered by other speakers. Social psychology, how individuals' thoughts, feelings, and behaviors are influenced by the presence of others. Social loofing, social facilitation. So there is a need to. Unlimited benefits at the workplace. Social psychologists, they work as a research psychologist, academic professors, or consultant. Clinical psychology has rightly been detailed by Professor Raju. And almost a large majority of the citizens are down with depression. बहुत आसान है इस word को use करना. I am down with depression. Is it the right word to use for the life that you have been gifted? Unlimited living beings में से आपको इंसान बनाया, human being. How you can say I am down with depression? This is defense mechanism that you need to take yourself away from such type of thoughts. Everybody is down with emotions. Stressors are there, but you need to cope with. You need to enhance your stress hardiness. If there is no stress, trust me, you will not be able to achieve the goal. You will not be able to have the A+ grade in the examination. If I would have not been asked by Professor Gawali to speak within 30 minutes, perhaps I could not have completed this material. So you need to set the standards for yourself and chase them. Nobody is going to help you. So again, it is you to decide कि आपके लिए क्या सही है. Then industrial and organizational psychology, friends, as I came from the government, I have seen this perspective. It applies psychological principles and research methods to the workplace and organizational settings. You are working with number of colleagues. You need to present yourself as a nice human being. You need to be at the expectations of the bosses or an employer. How to maintain the interpersonal relationship. How to be productive. So this is the right time, friends. We are father, we are guardians, we are parents, we are teachers. Please ask this question to your students, your dependent. Define yourself. Who am I? When your dependent, your students will be able this answer, then trust me, they will be able to identify their strengths and weaknesses. And when they are able to identify, then choosing the right career will be the right choice. Else, the employee will not be productive. He will not be satisfied. He will be down with number of stressors, resulting organization will not be productive. Our nation will not be productive. So at both end, losing condition. So if you wish to create the environment of win to win, then there is a need to work on it. Industrial and organizational psychology. Educational psychology, friends, we all are working in this domain. Individuals learn and develop in educational settings, learning, teaching, and educational outcome. This is the area in which we can help our students. They may work as a school psychologist almost in all the private schools. In the government schools are recruiting the school psychologists, educational consultants, research psychologists, academic professors in this domain. School psychology, again, crucial role in promoting the educational success and mental well-being of students. This is a very important domain of the human life. If we are able to guide the students in the right direction, they are going to pay back in days to come as a nation builder. Counseling psychology has rightly been touched by Professor Raju. And again, this is very important. Almost in every discipline, counselors are there. Okay. Rehabilitation psychology, this needs to be, when you are using, when we are living in the environment everywhere, we cannot trust upon the product quality, what we are eating, what we are using, what we are having altogether. There is a question mark, resulting number of deformities or challenges in our body. So if a person is down with disabilities or chronic health condition, how to take care of them? He or she is the part of our family, our society, how to take care of them. So rehabilitation psychologists in various settings are very useful, including hospitals, outpatient clinics, and private practices. Consumer psychology, friends, 2-3 slides more. How to study the behaviors and motivation and preferences of an individual. Online analysis. If you are choosing a product on the Amazon and decided to include into the basket, unless you have not decided to buy it, they will analyze your behavior. The online application will analyze your behavior, and they will offer number of discounts so they can capture your buying habits, a decision-making habits, consumer behavior. Consumer psychologists can work in various settings, including market, research firms, advertising, consulting firms, marketing departments, and so on. Psychopharmacology and substance abuse, बेइंतहा इसका use हो रहा है, friends. Now, drugs and medications affect the brain, behavior, and mental process. So the employment opportunities can be found in various settings, including substance abuse. जेल में बहुत काम हो रहा है, हम काम कर रहे हैं. Mental health clinics, hospitals, research institutions, and so on. Health psychology. This domain has been touched by forensic psychology also by Dr. Raju, sports psychology also by Dr. Raju, criminal psychology. Why they behave, why they consider in a different way. Career path, the job outlook for criminal psychologists is generally positive, as their expertise and insights are valued in understanding and addressing criminal behavior. ये जिम्मेदारी तो लेनी पड़ेगी. We need to take care of responsibility. We have been gifted. We are well qualified. You have been chosen to study in prestigious institutions. You need to take the responsibility. In turn, you will be paid back. Psychometry, friends, wonderful discipline, involves the measurement, assessment of psychological attributes or traits. Psychometry, development of the test. In Indian Railways, I was responsible for selection of safety staff through psychological test. जिस तरह से फ्रेंड्स हम और आप डिफरेंट हैं, इसी तरह से हर जॉब भी डिफरेंट होता है. So there is a need to match your competencies or abilities or knowledge to the job, so you can perform as per expectations of the employer. Psychometry. This is the area in which there is a need to work on. Staying with the Aligarh Muslim University, Aligarh, in last 8 years, I've been able to develop 22 plus psychological tests, developed, standardized, and published. Trust me, this is the area that in which you can excel. So, this career is very much connected to my heart. Psychometry. Sometimes we got some opportunity to share this knowledge. Right now, I'm not in a position to share my 24 tests with you. Wonderful career. Psychometrics can work in various settings, including schools, universities, research institutions, medical facilities, and private practices. Number of case studies. Whenever there is an accident, then causes of human error in train operation. In Indian Railways, we are having psychologists, psychotechnical units in every zone. Psycho officers are there, assistants are there. They are responsible for selection of safety staff, direct recruitment as well as promotion, and research study whenever there is an accident. Wonderful application. So friends, concluding 2-3 slides, benefits to study psychology. You can go get a degree and become a professional psychologist. It is you to decide. It is a well-respected profession around the world and is well-paying as well. Beyond professional psychology, you can apply your knowledge to studies of human behavior in anthropological and social scenarios all over the world or in laboratory settings. We are having psychophysiological laboratory. I'm working on number of experiments and wonderful results. Perhaps one of the reasons to play with the numbers, I know how to torture the number. So this domain again is very important. If you decide to torture the number, trust me, they will confess. As a researcher, as an academician, you need to love to play with numbers. You can use your knowledge of people to pursue a career in law, management, or education. This will help to save the world by helping the needy through social works, fighting crime. Psychology grades are in demand everywhere. Degree in psychology everywhere, in every discipline. Coming days में और बेइंतहा इसकी utility है. And the beauty after studying the psychology, it helps you to know about yourself. Self-awareness. Who am I? In traditional settings, during the infancy, तरह-तरह के labels हम पर लगाए जाते हैं. पढ़ते नहीं हैं, कुछ नहीं करते हैं. लेकिन when you know about yourself कि मुझे ये अच्छा लगता है, then you can chase your profession, passion. So after studying the psychology, you will be able to know about yourself. This will help you to improve communication. You will be reading the emotions of others. You will be able to control your emotions while speaking. Better understanding of others. Empathetic approach will be there. When I was in pain, if other is in pain, then how he or she will be feeling during this situation. Problem solving skills, career opportunities, increase mental well-being. Trust me, having the background of statistics, हम तो science के student थे. Later on, I decided to go for humanities, social sciences. Now, ease of mind, increase mental well-being, deeper understanding of society. You will be able to relate yourself, work with for others, help others, and definitely it will pay back to you. Research skills, personal and professional growth, and impact on society. So research completely 2-3 slides. Behavioral science research encompasses the systematic investigation of human and animal behavior through scientific methods. So number of methods are there, sir. Within 5 minutes, I'm concluding, sir. I hope, sir, I have time, sir. Anjali? Hello.
Yes, sir. Yes, sir.
Within 5 minutes, I'm concluding my talk, I suppose.
Yes, sir. Yes, sir. Yes.
Thank you so much. Thank you. I have time now.
Yes, yes, sir. You can
Thanks, sir.
conclude.
So,
Professor Khan,
sir,
we just take another 2 minutes and conclude because the other research person is waiting.
I will finish within 2
It's a
minutes.
very
Sir.
interesting session going on. Sorry for stopping you in between. Yes.
I will finish within 2 minutes,
Right,
sir.
right, please.
Right
Please
now,
go
I have discussed about the behavioral sciences. Now, how to relate this topic with the research. So, number of domains are there. Then you can work as a researcher, research scientist. Career as a researcher, as academics, applied behavior analyst, mental health counselor, social scientist, organizational behavior specialist, market researcher, policy analyst, and many more. So friends, from the research perspective, देखिए, this is the circle, wonderful circle. In every domain, you can fit yourself. As a research scientist, planning, business process, interviewing, task analysis, facilitation, interaction design, semantic design, usability testing, remote testing, experimental design, survey design, data analysis, unlimited scopes for a behavioral scientist. Some statistics बेइंतहा use है थोड़ा, and some common jobs that you will be going through this slide for the behavioral scientist and psychologist. And Indian agencies, number of Indian agencies are recruiting psychologists. DIPR, Defense Institute of Psychological Research, wonderful application for Army के लिए. BPRD, ISRO, SPG, I work for them, RAW, CBI and IB. Unlimited scope, हर गवर्नमेंट इंस्टीट्यूशन में एक नंबर ऑफ साइकोलॉजिस्ट की जरूरत है. ये स्लाइड बहुत वंडरफुल है, मैंने इस पर बहुत काम किया. आई एम श्योर यू विल गो थ्रू इट. इंडियन काउंसिल ऑफ मेडिकल रिसर्च एंड number of institutions are there. Psychological research center, teaching, welfare, assessment centers. अब तो देखिए इसके बगैर काम नहीं चलना है. Thank you so much, sir.
Thank you so much. So wonderful, very detailed careers in psychology. Yes,
Thank you so much,
particularly
sir.
research.
I will be available to answer any query, sir. I'm waiting for the
At
session.
the end, we will be answering some of the questions. I have already been answering. I have been answering questions on chat box.
Thank you, sir.
So Anjali, yeah, over to
Thank you,
next resource person.
Yes. Thank you so much. With sir's permission, because many of you all were asking about the PPT, with sir's permission, we'll be sharing the PPT with you all. Now I would like to call our next resource person, Dr. Dipti Puranik. Dipti Puranik, ma'am, is a forensic psychologist and is working as an assistant professor in NMIMS, deemed University, Mumbai. Over to you, Dipti.
Am I audible? Am I
Yes,
audible?
yes, you are
Yes,
audible,
yes,
yes. Yes, Dr.
Yes, so Anjali ma'am, are you presented?
If
Sharing
you
the-
want, I can. Yes, I can.
Yes.
Yes, yes. Dr.
Okay.
Shilpi, go ahead.
Yes, thank you so much, sir. And I would first like to take this opportunity to thank sir for giving me this opportunity to talk about careers in forensic psychology, which is a field which is very close to my heart. So to talk about, I mean, just to give you all a brief idea about why I say it's important in terms of, why it is close to my heart is because of the kind of experience I got when I was working on various kinds of cases. So some of the cases which I got an opportunity to work on where, Anjali ma'am, can you just change the PPT? So yes, so some of the very important cases, or rather most sensitive cases that I got an opportunity to work on was Arushi murder case, Beerman case, Vijay Palande case, SRA fraud, Malegaon blast, 7/11 train blast, and various other cases as well, which were very sensitive in nature. And the reason for sharing these cases or the importance of these cases is to highlight the role that a psychologist plays in criminal investigation. Next slide. So before we move to forensic psychology, I would just like to give you all a very brief idea about forensic sciences. So forensics originated from the Latin word forensis, which means deliberations in open court. So forensic science is the application of various physical and social sciences to provide scientific evidence to the court of law. So when we talk about Indian scenario, what we need to understand is that the burden of proof is on the prosecution. What we mean by burden of proof is that it is the responsibility of prosecution to prove that the person who has been arrested is the one who has committed this particular crime. So there are various types of evidences, mostly which are direct, indirect, circumstantial, corroborative, or they could be in form of physical material. But what is important is when it comes to human beings, and that's where psychology comes into the picture. Next, ma'am. So what exactly is the role of a forensic science? So forensic science helps establish the scientific evidence, which is the actual incident occurred, and it directly links the crime with the criminal. It also helps in fixing up the offense place. It helps enlighten the modus operandi, what was the mode of operation used, and it is establishment of the fact by use of scientific evidence which cannot be denied. At the same time, it is not a time related. I mean, if a case has happened 10 years or 15 years ago, even then, this tools or rather forensics help because they are an authentic tool in the hands of law enforcement agencies and honorable judges when it comes to making a particular decision about conviction or acquittal of the person who has been arrested. Next, ma'am. So each and every field, when we talk about forensic science, has an application to law. And when we talk about application to law, or when it comes to legal aspect, that's when the science turns into forensic or chemical sciences or humanities. That is when it will come. So now moving ahead to what exactly is forensic psychology. Okay, Anjali ma'am. Can you just go to the next? Yes. So talking about forensic psychology, it is the application of psychology to the criminal justice system. So forensic psychology knowledge is used in various forms, such as in treating the mentally ill offenders, consulting with attorneys, or for example, picking a jury, analyzing a criminal minds and intent, and also practicing within the civil arena. So today, in fact, I'll be discussing about what exactly are the careers. I mean, as a forensic psychologist, where all can a psychologist work in when we talk about the field of forensics. Ma'am, next. So we always say that forensic psychology is a very unique area in the forensic sciences. As when you look at forensic sciences, we mostly have been relying on all the physical evidence. But forensic psychology is the only field wherein we are directly dealing with the human beings. So when you talk about a crime, where does crime gets planned? It is ultimately planned in the brain of the perpetrator, which means the most important link to the crime and the investigation is the human brain, which is analyzed by the forensic psychologist. At the same time, globally, or especially in Indian scenario, mostly we have been neglecting this core variable that is human being in a forensic lab, because we pay a lot of effort when it comes to collecting physical evidence, and at the same time do not analyze the human behavior patterns that are seen on the crimes. So a forensic psychologist is the one who helps kind of bridging all these links together, binding them together, and helping the investigating agencies get physical material or physical evidence that can be produced in front of the law. So also, with the help of forensic psychological technique, you would be able to define or to understand what role this offender has played in this particular crime, in terms of whether he was just a planner, whether he was a kind of the actual perpetrator in terms of actual person who's taken the offense, or he was just a witness or kind of an accomplice. So all this can be linked as well as studied, analyzed with the help of forensic psychological techniques. Ma'am, next. So most of the time when we talk about forensics, people get very excited listening to the term of forensic psychology. However, what is important is to understand how has the field of forensic psychology developed. And it is not a subspecialty all of a sudden or a specialization all of a sudden, but it has been developed through various other subfields of psychology itself, like clinical, neuropsychology, legal, criminal investigation, cognitive, social, counseling, developmental. In fact, forensic psychology cannot be, what I mean to say is that it cannot work in individual. As a psychologist, whenever a psychologist stands in the court is when he comes under the purview of forensic psychology. So a forensic psychologist will have to have knowledge about clinical, abnormal psychology, neuropsychology, or developmental psychology, cognitive, criminal, and all these together, and in fact many other fields have been interlinked when we talked about forensic psychology. So the specialty itself, so the forensic psychology itself have lot of principles that we apply on criminal investigations, and the same principles we would have read or learn through all these disciplines that we study when we are studying psychology. So now let's come to actually work that is done by a forensic psychologist. Like I said, as a psychologist, you would be learning a lot about when it comes to cognition. what are the memory systems, okay, or what are the different kinds of memories that an individual has. So when we talk about different memories, where will its application be? In the field of cognitive psychology. So similarly, when we talk about what work a forensic psychologist do, they do work in two main aspects, 2 or 3 main aspects. One is when a forensic or psychologist works for the investigation. Secondly, when they will work in terms of the judicially, which is after the person has been arrested, there is again a work of forensic psychologist. And thirdly, they would be working even in the civil areas. So when we talk about in terms of investigation, forensic psychologists conduct psychological autopsy. What exactly is psychological? You all must have heard about autopsy. Autopsy is like an investigation of the dead body. But what a psychologist do when they do the work of a psychological or when they conduct psychological autopsy is conducted to understand the mental state of a deceased before his or her death. So, you know, what exactly led to the death of this person? What was the mental state of this person before his death? So there would be, these are the aspects that are looked upon in terms of psychological autopsy. Another very important aspect is that of criminal profiling. Criminal profiling, in fact, most of you all must have watched the famous web series on Netflix, which is Mindhunters. Okay, and you know, it's kind of a series that always enhance that how did criminal profiling come into picture. So criminal profiling, in fact, psychologists work as criminal profilers, wherein they help understand or rather analyze the behavior of the crime scene and help create a psychological profile of an offender, which helps the investigating agencies narrow down their search and look for the offender who may have committed the crime. So that's where psychologists play a very important role when they work as criminal profilers. Another important thing is psychological profiling, which is to be conducted with almost all the individuals who may have been suspects or accused. So psychological profiling is wherein there would be various kinds of assessments which are done on this subject who has been referred for evaluation, psychological evaluation. So wherein the main focus is on the interviews. So the interviews, psychological interviews that we learn is what we apply directly when we do profiling. Along with the interview, we also use a lot of our psychometric assessment tool, which we have been trained in. Apart from that, a forensic psychologist would also work or have a career as a polygraph expert or a lie detector expert, wherein they study or they analyze the physiological changes in the person's body when the person is lying about a particular questions that are being asked. So whether it comes to whether they have been involved in a particular crime. So to help that out, to extract truth is when polygraphs can be used. Similarly, there are all these other techniques like layered voice analysis, wherein you analyze the behavior of your voice. Then there is brain electrical oscillation signature profiling, wherein we actually try to understand or try to extract memory from the brain of the perpetrator by analyzing or by cueing specifics, giving specific cues so that it helps remember. So there is a direct contact of remembering using electroencephalogram, which is EEG. So that's how we use brain electrical oscillation signature profiling. Psychologists also conduct a lot of interviews when we talk about narcoanalysis. So narcoanalysis is where the person would be in a semi-conscious state, and a person and a psychologist has to interview the person knowing their semi-conscious state and how they are answering. So the entire interview is carried out when we talk about narcoanalysis. Next slide, ma'am. Now, this was more from the investigative perspective. At the same time, when we talk about the clinical aspects, or what happens when the person is arrested, again, when the person is arrested, there's ample of work. In fact, the psychologist work starts when the person is arrested. So when the person is probably in a lockup, whether there is any kind of stress that the person who is undergoing. Specifically, I'm using the term person or a human being because we cannot directly call them as accused. Since they have been arrested, they might be under suspicion, but we have to assess whether they are, not undergoing stress. Are they comfortable with the thing? So all those kinds of assessments, psychological assessments, have to be conducted when the person is in lockup. At the same time, the psychologist will also consult with attorneys. So, when any kind of legal case is going on, lawyers will take help of a psychologist to understand whether the person was fit, or whether in what way can the case be analyzed, and all these things would be done with the help of attorneys. Another important role that the psychologists do, clinical forensic psychologists would be to assess the criminal responsibility. What exactly is criminal responsibility is that, okay, you have the person in front of you who accepts or who confesses that he or she has committed a crime. However, to assess whether the person who has committed a crime is the person responsible for the act that has been done. Were they mentally fit enough when this particular crime was being committed? So those kind of very specific clinical assessments would be done by a clinical forensic psychologist who would assess either for criminal responsibility as well as for competency to stand trial, which means that whether the person who has been arrested and now has to undergo a standard trial, is the person competent enough? Do they understand the actual proceedings that are going to follow? So all that is where the psychologist assesses and helps do a lot of counseling work. Then another aspect or another careers for forensic psychologists is when the person helps with eyewitness testimony. In fact, in recent years, we have seen that, a lot of time witnesses go hostile. So to help witness remember that event better, to be able to give accurate information, the psychologist helps eyewitnesses when their testimony is being taken, because eyewitness testimony or eyewitnesses statement is considered to be the most important direct evidence in the court, and that's why the psychologist helps in getting the accurate testimony when we talk about eyewitnesses. Apart from that, there is also ample of work that they do as child custody. So, especially when child custody is, there is a fight, or when we are talking about cases. So, the father has been arrested for a particular crime, and then whether the custody after the father has been released, can it be handed over to them? So again, for that matter, child custody is what is looked for. Then we have another, important aspect, which is rehabilitation. In fact, psychologists play very important role when it comes to rehabilitation. So a kind of, helping a person, because when they have been through lot of kind of, we would say, stress, they would be also suffering from PTSD or any other kind of, psychological issues, especially when they were going or they have been in prisons for many years. Coming back to normal life, that itself takes a lot of toll. So psychologists play very important role when it comes to rehabilitation of offenders, and that's how they help in terms of helping all these people come back and be accepted in the normal society. Another important career for forensic psychologists is jury selection, which is not so applicable in Indian context, but it is being used in many other countries, wherein psychologist helps in choosing the right kind of the jury, or when it comes to selecting a jury or 12-member jury. So that's where psychologist is the one who would do lot of surveys, who will look for, analyze the attitudes, behaviors of the jury members to see whether there would be any kind of bias, or whether the jury may take a decision in terms of being biased, or in terms of, kind of whether they are going to be very objective. So that kind of assessment is what would be done by a psychologist. Next, ma'am. So this was overall when we talk about what is the role of a career for forensic psychologists. So when we talk about a psychologist, it's not that a psychologist themselves, there are courses in forensic psychology, but most importantly, a psychologist has to understand the links of all the other subfields of psychology, together with which they can work as a forensic psychologist. At the same time, a psychologist needs to also understand the legal aspects or the laws pertaining to the particular country in which they are working. So, because the awareness of the legal system and awareness of the psychological principle, both of them are extremely crucial for a psychologist's role. Psychologists have been, in fact, forensic psychologists have been appointed by a lot of corporates, as well as they work with government agencies. They work with military officers as well. At the same time, they also are, in working with NGOs, especially when, especially NGOs and all, wherein there is a lot of rehabilitation work which is being done by the psychologist. So that's it from my side. If you all have any questions, you all can please feel free to ask those questions.
Yes, so many of their questions have already been answered on chat box and question. In case if anything, maybe at the end we can cover. So thank you so much, Dr. Dipti. Yeah, over
Thank you,
to
Professor.
Ms. Anjali.
Thank you so much, Dipti ma'am. Now I would like to call Dr. Shubhakar to share his session on competency mapping and
Dr. Dipti be there, Dr. Khan be there. In case if any questions, it may be answered at the end.
yes, you
Yes,
can send your questions to me. I'll share it with her.
Yes, all questions have been answered. Some of the questions, please go ahead.
Yeah. Dr. Shubhakar is a psychologist working in the field of organization. His areas of expertise include organizational behavioral research, and mostly in corporate settings. So he have developed many assessment tools for IT and non-IT companies. So over to you, sir. Please share your knowledge with us.
Thank you. Thanks, Anjali. Thank you, Gautam sir, for this opportunity that we can share some details on the aspects of psychology, and welcome everybody to this little sharing on careers in psychology, and very specifically to do with organizational behavior and competency mapping. Let me put up my screen. And as this is loading onto your screens, just want to share something about what happened with my career and how I moved into this. When I was doing when I was in my final year psychology last semester, typically where we are exploring about what kind of a work opportunities that I might have in the field of psychology, when I was very perplexed. Reason, I could only see two options. One, getting into clinical or a counseling side, which I had my own reservations, and where I was thinking that, okay, when if you're in clinical side, if you're in counseling side, whole day, you're only listening to the pain of an individual, pain of another person, and at one point in time, it might take over you. But that was the thought that I had. And the other option that I have seen or understood was into teaching. And because it was very clear for me that I don't want to get into clinical side for my own reservations, I moved into the teaching. I was teaching psychology students at undergrad level, psychology students at master level, and psychology students who were doing Bachelor of Education and Masters in Education. This I'm talking when I started my career in 2005, was teaching. And after a couple of years, I realized that, okay, I'm only teaching the same thing over and over again. The same concept I'm teaching is just that there is a new batch of students, and otherwise the syllabus is the same, the practicals are the same, everything is the same. And I was like, what else? What else could I do? And that's where, when I was exploring it, I have seen such a potential in the corporate side for the psychology. However, at that point in time, things are very different now in today's context. But at that point in time, I'm talking about 2008, 2009, preference was more given to MBA students than somebody into psychology, because people thought somebody who has done MBA HR or MBA into the human resource side would add a lot of value to the organization than somebody who's coming from a psychology background. And coming from that, I had no option than to join the organization into the HR side, and then started seeing how things could work and how much potential there is for a person with psychological conceptual background and experience, and then moving into the HR side of the organization. What I've seen through these years, and currently I work with this organization called Harrison Assessments, and before that I was with Wipro for a longer time. And what I've seen, each organization, when they want to bring in a talent from outside, maybe from the campus, or maybe from a different organization to this organization. For example, if any organization, say something like Wipro or Infosys, going for a campus drive, they are technically bringing a fresh talent inside the organization. Now, these fresh talent might have a lot of skills, knowledge, attitudes, behaviors, but what organization is looking at is how this talent can be fitting into my organization. And that's where I have seen a potential. And even if you recall, or if you, I'm sure you have a lot of friends who might have gone through a campus interview settings or gone through some interviews. When you know that when typically a campus recruitment happens or a campus drive happen, there is a set of assessments given, there is a set of questions given. If it is something like, say, Wipro is going for a software engineer, they are giving out some questions on aptitude, they are giving out some questions on Excel or PowerPoint or some technology, and then 1,000 people going through the assessment, and then they shortlist about 500 people, and then interview about 300 people, and finally maybe 200-300 people join the organization. Now, what's happening in this entire thing, from one phase to another phase to another phase, till somebody joins an organization, there is a set of screening that is happening. There is a set of filtration that is happening. And filtration for what? Filtration to get somebody who fits into the expectations of the organizations, maybe from a knowledge perspective, maybe from a skill perspective, or maybe from a behavioral perspective. And that's where the psychology comes into play, where you can work on that and then give that representation of the talent into the organization. When in the past, these 15 to 18 years of work that I have done into this section of psychology, I've seen immense potential of how the knowledge of psychology could be used from a different perspectives of the organization's requirement on the talent. May it be related to the talent acquisition, which is recruitment, or talent development, or employee engagement, or succession planning, or leadership development. You look at any gamut of these talent spectrum, technically depends on what is it that the organization is looking at, maybe from a recruitment perspective, fresh recruitment, or a recruitment of a fresh graduate, or recruitment of a person with a high experience. Is it the same? No, it is not. If somebody is recruiting from a fresh graduate perspective, probably there is a high weightage given on the eligibility side. What is the technical knowledge? What is the technical competency the person has? What kind of a skill the person has? But when the individual moves higher the ladder in the organization, say maybe from a software engineer, somebody is moving, getting promoted to be a team leader or a delivery head or a vice president, your knowledge and technical skills, yeah, it is taken for granted that you know about it. However, it is the behaviors that matter the most. And that's where the competencies come into play, a combination of all these things, wherein probably an assessment of knowledge and skill might seem very easy, but gaining a measurement, developing a measurement model into the behaviors is a slightly complicated process. And what happens into the competency mapping, trying to understand how and what kind of skills, abilities, or knowledge the person is required at one job and at different levels in the organization. And each organization has their own value framework. Each organization has their own vision framework. However, when somebody is coming from an outside into that particular organization is looking for a process or a methodology or a framework wherein I need to find out how best this outsider coming in the organization will gel with the value framework or the culture framework or the vision and mission of the organization. You can imagine maybe a software engineer, the title remains the same. Maybe if it is a Infosys or a Wipro or a Cognizant or any organization that you name, maybe the designation may remain the same as a software engineer. But working in Infosys may not be exactly same as working in Wipro or any other company, because even though the technical skills might remain the same, maybe you need a good exposure on .NET, Java, Python, or Excel, PowerPoint, fine. That's more your technical knowledge that you're learning from your college, or you're acquiring some kind of a technical exposure. But the behavioral expectation or the culture expectation or the competency expectation from one job to another job and one organization to another organization entirely different. And while in your college, if you're from humanities background, if you're from psychology background attending this webinar, your course will teach you the process of what happens into the competency mapping. But practically inside the organization, it is the role of a psychologist wherein you are defining a framework on which there's a lot of dependency that comes in across the organization. May it be related to HR planning or job analysis or recruitment, placement, performance management, training and development, succession planning, rewards. You name any spectrum of the HR function that happens, which is more from a human development perspective or a human involvement perspective, there are competencies which are dependent. And how does this happen? Or even before that, when somebody is getting inside an organization, this is something that I have seen out of my experience into this. Different kinds of people that we meet in an organization. There are people who know what their competencies are, or who know what they are good at, and who know where they can apply that. They're very balanced into it. They're very clear about what they know. They're very clear about where they can utilize this, where they can do that. Now, that's fine. And again, you also have another set of individuals where they also know very clearly balanced deficiency. They know that they don't know anything. They know they are not good in communication. They know they are not good in problem solving. They know they are not good in the leadership development. So that's fine. So a set of people who are balanced versatility, they know what they want to do or what they have, what kind of a capabilities, abilities, competencies they have. And balanced deficiency, they know what they are not good at. But a lot of team conflicts come up with section of people who have this aggressive imbalance. What I mean is, I think I know everything. I think I can do well. And there are a lot of instances inside the organizations where there are people who are so aggressive and take up the projects, they snub everybody out and say, I will do because I know how to do it. Wherein they take it up, they know they cannot do it. They don't want to leave it because they've taken it already. And then the entire project goes for a loss. They think they know everything, but they really don't have that balance of how to achieve that. And there is another set of people, passive imbalance. They have an innate ability or they have that innate competency, but they think they don't have. And these are the set of people who keep quiet. They don't want to come up. They don't want to come out. They don't want to be expressive. And then they just make things as if they don't know anything and then lose out on a lot of aspects. You have a set of all these people, but how do we measure them? How do we know? How do we know? And the kind of work that we do, the process that we follow, established model, there's nothing new that I'm talking here, wherein get into a lot of focus to group discussions with the key stakeholders, sometimes founders of the organization, sometimes one level down to these founders, trying to understand what is this mission, vision, what are they looking at in the long term for the organization, and based on that, try to arrive at the competencies. And once this competency names are finalized, maybe communication, problem solving, agility, or interpersonal skills, or coaching, judgment, whatever that comes up that aligns with the organization's vision, mission, model, and the kind of expectations that they have from the organization, then the next step of defining the competencies. Now, this is a very critical thing, defining the competencies and identifying behavioral indicators for each of the competency. Practical experience, people define it using a very nice language thing, but there are too many overlaps into the definitions. Something that people write on communication overlaps with probably teamwork. Something that they have defined for, say, a problem solving overlaps with decision making. So competency definitions and the behavioral descriptors, when there is a lot of overlap into that, as a person measuring that, because as a psychologist, as a person into the organizational behavior, you're defining this model, you're defining the framework. This is a one-time activity, may happen maybe once in 5 years or once in 10 years. Companies don't create competencies every month. It is a one-time activity which runs for a longer period of time. And when you're creating this competency framework and giving in the organization, and when this gets executed inside the organization, every job role is impacted with the kind of proficiencies that you're giving into each competency, with the kind of expectations that you're giving into each competency, and the kind of expectations that you're giving for each role. Now, if there is too much of overlap into this, it becomes so confusing for the person who is executing that, because I don't know what I'm measuring. Communication seems same as teamwork, or problem solving seems same as learning agility. So having those clear definitions, clear behavioral indicators, very crucial when we are getting into these kind of a competency analysis. And this kind of a work on the competency analysis, competency frameworks, gives a broader exposure into what kind of a pattern these organizations are having and how they are moving from one level to another level. What is it that they are looking from today to the next 5 years, today to the next 10 years. All these things are something as a person into the organizational behavior, as a person in the competency mapping framework, you need to keep in mind, because what you're doing is going to impact the entire gamut of the organization from all perspectives that are related to the talent. Now, yes, once we define it, then comes the metrics into it. How do we measure? Because somebody who has done, who may be having a lot of knowledge on, say, technical knowledge on how to do a Java programming may not be good on the problem solving. Somebody having a very good proficiency in English language may not be really good in his communication skill. Both may not be dependent on each other. Now, from a behavioral perspective, yes, from a technical perspective, I can do a measurement of the knowledge and the skills, but from a behavioral perspective, how do we measure that? Now, to arrive at this, the formula that we use at Harrison is each of the competency we try to understand from the organization. If the organization already has a definition, get into a focused group discussion to understand the competency framework. And then for each of the competency, try to align a trait composition. So you need to understand here from a behavioral perspective, no single factor is a knockout factor. A behavior of an individual depends on multiple factors. We cannot just take one factor at a time and say, just because I'm good at one aspect or good at one trait or not good at another trait, I may not be a high performer or a low performer. My performance on a competency, my predictive performance on a competency, and that's what we are trying to measure from an organization perspective. What is the predictive performance of this individual on the competency of, say, communication, on the competency of, say, a problem solving or any other thing? Depends on multiple factors, multiple traits. So we align this in terms of essential traits, which are like must to have for that competency. Say, for example, if I'm saying communication as a competency, must to have for the competency, higher the preference, better the performance. Maybe something like being frank, being direct, maybe very essential to have a good communication. And maybe some desirable traits, good to have traits, threshold traits, maybe my warm empathy, my nature of being warm empathy, or my nature of being assertive, or my nature of being helpful, maybe a desirable trait. Put that into the desirable category, because these are the threshold traits. But for my communication to be very effective, I don't need to be 10 on 10 on warm empathy or 10 on 10 on helpful. But if I don't have at least a 7 out of a 10 on warm empathy, because of my lack of preference to that warm empathy, that might pull my impact down on the communication. So these threshold traits are my desirable traits. Having to one extent is fine. Not having a greater preference to that may not add bonus. And equally important, the negative traits which might impact, like traits like maybe blunt, maybe dogmatic, maybe harsh. If an individual has a high preference to these traits which are negative, there might be a negative impact on the competency. Now, giving this measurement model wherein very clearly explain the client that, okay, if you're measuring a competency of, say, communication, it's not just important that you need to look at only positive traits. It's equally important that you look at traits which have the threshold or which have some impact, or not having that would have a negative impact, or some negative traits which having a high preference would have a negative impact, and some positive traits having a high preference will have a positive impact. A combination of these three factors or these three categories of traits give a measurement of the competency. Now, 2 steps we have come. 1 step, okay, at the beginning of somebody getting inside the organization, there's a campus interview happened. Technical knowledge is assessed. Maybe a HR has taken some kind of a interview. The person is coming in. The person has come in to the organization, and then maybe spent a couple of years, and person is looking at moving up the ladder. The person applied maybe for a succession planning or a promotion. or is a high potential that the company has identified, and then you have given a measurement model of each of the competencies. If the organization has, say, 10 competencies, you have given a measurement model for each of the 10 competencies. Now what? I get a measurement. I'm maybe about my proficiency on communication is 70%, or proficiency on problem solving is 90%, proficiency on learning agility is 60%. Now what? I know. And because all the assessments are giving an insight to me, are giving an awareness to me about what my current status is. And that's where the next impact of a psychologist comes in, wherein you can help the individual work through their competencies. Now, any of the psychological assessment or any of the framework can have an impact to a certain extent, because I can only create an awareness by telling an individual that, okay, this is your proficiency on this competency, or this is where you are, or this is where you stand on a particular competency. Now, there are different levels, and how do I grow? How do I use that? Maybe in the beginning, I'm unconscious about my competency. I don't know. I thought I know about it, but I didn't know about it. And creating that awareness, move from that awareness stage, helping the individual work on that. Not just using the classroom trainings, because lot of HR people do a lot of training programs which are classroom programs. Nothing wrong in that, but the impact of classroom training is immediate. I attend a classroom training, I feel wow about it. I feel so nice about it. And after 2 days, 3 days, 1 month, yeah, what I remember about the training, yeah, I attended the training on communication. I attended the training on problem solving. What am I impacting, or what am I practicing? I don't know. So for this purpose, organizations employ psychologists who can be career coaches inside the organization. And that's another lucrative field, highly remunerative field, and highly credible field, where we are helping the organizations, not just creating that competency framework, which is more a document, which is more a brain work, more of you writing something and you discussing something, a lot of interviews, a lot of writing, and then you create a model. Fine, that is a one-time effort you've given. Now then, working through each individual throughout their career, throughout the development journey. We call it as a learning journey or a development journey, where helping the person work very consciously on their developmental area. Maybe it's a 9 months journey or a 6 months journey. What we are trying to do as a senior manager, the person is highly competent in the technical side, but there are certain behavioral aspects of it which needs certain attention. Say, for example, I'll give you an example on communication. People think communication is either I'm direct or I'm diplomatic. If I'm extremely direct, imagine a situation, if I'm extremely direct, without having enough diplomacy, my team will start figuring me out as somebody blunt. So the frankness gets replaced by blunt, because I'm so direct in my communication that people are not seeing me as direct. People are seeing me as blunt, and blunt is not nice. Being like a Hitler is not nice. And because of that, my team may hesitate to talk to me the real issues of a project. Or somebody is extremely tactful, extremely diplomatic, wherein the person is so diplomatic, so nice, so goody-goody kind of a person that his entire team starts thinking, na, iske saath to chalega. I can do anything. I can manage this boss, which is definitely not nice. Being extremely direct is not helping me. Being extremely diplomatic is not helping me. There need to be certain balance between my frankness and my diplomacy, because of which the unintended consequences of both these traits could be mitigated and managed. And what the career coach inside an organization does is not just the classroom trainings. Classroom training is a one bit of it. More than that, it is helping the organization, helping each of the employee do that developmental journey where people see themselves, and then throughout this 9 months or 6 months development journey, how things have progressed in terms of, because when I'm trying to improve my communication, as I said, the frankness and the diplomacy is not just having an impact on my communication, it's having an impact over entire way of how I manage my team. So this is some of the aspects that a psychologist inside an organization can do a lot of impact. Not just the documentation work, but a lot of on-field work which impacts the return on investment for an organization. And this is what I had to share. And questions, happy to answer.
Yeah, Dr. Shubhankar, yeah, we'll keep some question answers at the end, because some of the questions have all been raised and we are answering the questions there itself.
Sure, sir.
Right. So thank you very much. And we can invite other resource persons. Dr. Shubhankar, you can be there for some time. Okay. So if there are any question, then I will let you know what are the question asked to you. Right?
Sure, sir.
Right. Thank you so much.
Thank you.
Thank you so much, sir. Now I would like to invite our other resource person, Dr. Freda. Dr. Freda is a psychologist, counseling psychologist, and she have been working in the field for many years now, and she have experience. She have successfully counseled around 500 cases till now. So that's a great achievement. Also, she have worked with children with victims of different crimes and everything. So she have knowledge of that field. So she'll be sharing her knowledge in that field with you all in this session, through this session. Dr. Freda, I'll be sharing the screen.
Yes. Yes. Thank you, Doctor. Thank you, Anjali. Am I audible?
Yes.
Yes, ma'am.
Very much.
Yeah. Thank you, sir. I'm so grateful to Dr. Gautam Gauli for giving me this golden opportunity. I know that time is really tight for me because of too many things happening in college, and but still you wanted me to be there, and I'm thankful because it gave me an opportunity to work in this area, though I do a lot of practical work. So I thought that why not to share my experience with young minds so that they also are able to understand how to grow in this field of counseling and be healers of the world, because there is so much of trauma that these young children are going through. And if we can help this young growing generation, we can be healers and we can bring peace in this society, which is really in turmoil and so much of suffering. So I will begin with my session now on child counseling. So what is child counseling? This is a branch of counseling psychology wherein we need to understand that children are experiencing lot of trouble, lot of trauma, and because of which, and this the root cause of which is the parents or is the family environment where they are being raised, because of which they end up into anxiety issues and depression. So there have been n number of cases that I have been looking into and trying to help the young people as they come into early stage of adolescence. This childhood trauma is noticed in their behavior, and as an adolescent they are having difficulties managing with their adolescent stage. Then they get into physical issues, they get into relationship issues, they get into difficulties in education, they cannot study, and overall their life is affected. And the root cause of that would be the upbringing that they are coming from, the type of family environment that they are being raised. So we as counselors have to understand that every individual is special, and we need to take care of their issues, like what is causing them depression, what is leading them into anxiety. And as a result of this, then they are going ahead into adverse illnesses. including psychological as well as physical. Both types of health issues they come up with. And this helps the child to understand the issues more clearly when they go for counseling, when they talk to somebody who can make them to understand that there is a fear, there is a confusion in your mind, and that their emotions need to be treated or their emotions need to be dealt with. Because if these emotions and these fears that they are experiencing in their home environment are not dealt with, they will overcome, they will encounter trauma in their life at a later stage, at which stage is the adolescent stage. So we have to work towards making every individual peaceful and happy in his life. So children get a better understanding of themselves and their problems when they go for counseling. So they understand what is the cause of their suffering, why are they behaving in a particular manner. So once they meet the counselor, once they come and discuss with the counselor, they are able to work on their traumatic life experiences that they have undergone as a child. So here they are able to understand an emotional balance. They can get to understand that there is a balance between their personal life, their physical life, their psychological life, and their overall well-being. Now, who are child counselors? Before we go to that, there have been n number of cases that have come in counseling, more than at least 2,000-3,000, since I'm in this teaching field for around 23 years. And many students have said that I don't know why I'm behaving like this. So at the adolescent stage, they understand, like getting into relationships which are uncontrollable. They get into relationships n number, not only one person. Say maybe one girl is having an affair with one boy, but that is unsteady. She's not steady in a relationship. So they ask me, why am I not steady? Why can I not stick to one person? Why am I having so many fling of boys or girls coming in my life, and I'm not able to maintain any friendship or any relationship? And my relationship at home with my parents is very abusive, very aggressive. So why am I like this? Most of the adolescents who come for counseling, they ask questions that why they are like this. Okay, now the root cause of all this would be trauma. Every problem has a root, and the root is the family environment. If they are living in an unhealthy family environment, then you will see their later stages of life, that is the adolescent stage, and the pre-adolescent and the post-adolescent stage will be very traumatic, and you will be able to see that they are having an n number of problems. So who are child counselors? Child counselors are mental health professionals who can help these children to take care of this type of problems: emotional, academic, social, developmental issues. So if their emotions are not catered to, their overall career or their academic or their social development, every sphere of their life will be affected, because their developmental milestone is affected. So they are not able to cross from one stage to the other stage. So here we see that the major problem that a child would encounter would be trauma, would be emotional dysfunctions, which can lead them into n number of problems. So here I have in this next PPT, next Anjali, different issues of child counselors would treat. So the child is getting into anxiety and depression at an early stage. Now this is a trauma that the child has experienced in his home environment. Now he's not been able to speak. There is physical abuse in the house where the father and the mother are fighting, and the child feels that he or she is responsible for the fights that are happening in the house, or grandparents are fighting, or the neighbors are fighting. So as a small little child, that individual feels, I am responsible and I'm not able to do anything. Okay, so normally the child will go and stand in front of both the parents. If father and mother is fighting and physical abuse is there, like I have gone in a school and they said, Miss, how do we handle this issue where father is coming to beat the mother and we go in the middle, we also get 2-3 slaps. So then all of us are suffering. I'm also in trouble and my mother also is in trouble. So it is best advised to them not to go in between the two elderly people who are fighting, but the child feels that he is responsible, as a result of which in later stages he gets into anxiety, and once anxiety comes at an early stage, then it becomes advanced and gets into depression, and then all mood disorders and all other psychological disorders. So here the child also feels physically, sexually and verbally abused, as a result of which the child is getting into bedwetting, he's passing urine on the bed, and parents don't know the reason. Now, this bedwetting are all behavioral issues. They are being traumatized physically, sexually, or verbally. Either ways, they are suffering. So then you will see that such children will do a lot of bullying with other children, other colleagues. Then they are having difficulty in coping with their separation and divorce which the parents are going through. So they are not able to cope up with that, because however bad the parent is, the child wants his father and his mother. Even if the father is an alcoholic, he's on the roadside. If you, in counseling, if I've seen that you ask the child, so this man is giving so much of trouble to you all, no, let us discard him. The answer is no. Okay, you pray. I want to see what is their reaction. So I tell them that keep him away, keep him somewhere else, put him in an alcoholic where they take care of these alcoholic people. You put them there. No, the child will say, no, he's my father. However bad he is, I want him with us in the house, and we will suffer whatever we have to suffer. But I cannot be separated from the parent. So no child wants to be separated from the parents, means either way, father or mother. So the parents mostly want to go in for divorce and all these things, because they feel that it is their life and they are least bothered about what the child is feeling. Okay, so now this leads to grief and bereavement, or maybe death of a loved one also will cause them problem, because they are not able to understand so many ifs, so many buts. This leads anxiety in later stages. As they grow up, you will find all anxiety related issues. Separation anxiety is a problem. Their self-esteem is low. They cannot stand up for themselves. They will have so many other issues like fighting with their colleagues, or they are siblings. Then they don't want to go to school. They will not want to mix with society, social withdrawal. Then they'll not be able to sleep. So these are all the types of issues that we will notice in this type of children. So what does a child need when he comes for counseling? Next. Okay. What does a child needs? Every child needs safety. Every child wants to be an achiever. I want to achieve. I want to get success in my life. Every individual is very active, but we blame the child and say, this one is a lolo. He cannot do anything. So he's very passive. He's very quiet. He's very reserved. Actually, no child is like that. It is the environment, it is the situation which has made the child like that. So every child likes to be made responsible. You give one responsibility to a child and tell her that you are a leader of this group and this activity has to be done tomorrow. And you will see that it is done, because they like responsibility. Every one of us want respect. And so the child wants to be respected, wants to be included in the team. And whenever you give them any responsibilities, but we deny them because they are children, and we think, oh, these people don't know anything, they are useless, they're small bacha party, and we ignore them. Okay, so issues faced by children are like military use of children. At a young age, they are sent for training, military training, or you see this terrorism. Early age, they are being trained, they are sent away from their home to be trained. And child internet pornography, where the children are told that you stand, I will post your pictures, but the pictures are misused. Okay, for pornography or pedophiles, how they take advantage of these small children. Not only small children, even early adolescent stage. Children are girls and boys at the pre-adolescent stage are misguided, misused. That, see, I'm taking your selfie, you take your selfie and send it to me. And then once the selfie reaches them, then they will misuse. All right, so many bad things have been happening. So I will say that take care. Children or adolescents should be advised not to get into this type of a pornography type of a thing, or use of internet wherein they are being exposed in a negative manner. They are bullied actually. They do not know that they are being misused. But because out of, as they are not getting any attention from their parents, and somebody outsider gives them a little attention and tries to say, see, I'm putting your picture on internet and everybody will get so many likes and all, they feel very happy about it, because they feel, okay, the world likes me, my family doesn't want me. So they want that recognition, and because of which they are ready to do anything. Next is child labor. Early stage, we employ children, and we think that as a child, he'll do anything just to make other people happy. Okay, but this is wrong, because we are misusing their innocent mind. Then they are neglected when they are not accepted in the family environment, this will be a very traumatic problem. So many students have come. More than, I will say, around 2,000 students came to me for counseling. I will say at least 1,000 of them have experienced neglect, where they are not getting recognition, where they are not getting appreciation, and that's why they get into all sorts of other problems. Lack of education, normally this is a problem for girls, where parents say that a girl does not require education. You're going to get married and you will be a mother and you'll have to take care of children and your household. So education is not that important for you. But this is wrong. We need to educate, whether it is a male child or a female child. Everybody needs to stand up. Tomorrow, nowadays, ladies, girls are more empowered. So if we make a woman empowered, definitely she will be able to raise her children in a better environment. Next, role of a counselor. So what does a counselor do? He understands that every child is an individual. This is the first step. If you think of continuing your career as a child counselor, then first thing you need to understand that every child is a special individual, and you need to identify in which area of his mind he is mentally weak, and that area you need to help the child to work over and come out of that negative mental problems or mental weakness. If the child is experiencing, then you need to strengthen those areas, and you need to let the child know that you can stand up. You have to voice your opinion. You have to stand up for yourself. Have a positive self-esteem, which will help you to be strong enough and acquire all your hidden talents, the best that you can do. Try to investigate and see what good you are at. Child-specific abilities, what the child is good at. So tap on those areas which are very, very special to every individual, because all children are not the same. So we need to understand their social problems and their personal problems, and try to help the child to strike a balance between the two. So now we go for child counseling techniques, the various techniques. Play therapy is one of it, wherein play therapy is used to deal with younger children, the ones who are smaller ones, who cannot speak up. But when you involve them into games or any type of play therapy, they will open up, they will share. If you give them a doll or another toy or small little children to play with, then you will see how they will interact. And the interaction of what the parents are doing towards them, you will be able to see and notice, and that way you will be able to help the child to come out of the traumatic experiences that he or she is going through. So the children need to speak up, open up, talk to the therapist. But this normally the child will not do. Any child will not do. That's why you have to put them into games. Once you put them into games, they will fight, they will show whatever is happening in their home environment will be seen in the game, in the play therapy. The child cannot hide whatever he's going through, whatever he's experiencing. He will hold the child and say, push the feeder and in his mouth and say, drink the milk, otherwise I'll throw you out of the house. So you know that the parents are also doing the same things. In the house, they are saying, if you don't eat the food, we will throw you out of the house. Or if you don't listen to me, I will lock you in the bathroom. The same thing they will do in the play therapy. When you expose them to play therapy, they will do the same, whatever is happening in their house. And on those terms, you will be able to understand what the suffering the child is going through. So play therapy is very effective for small children. Cognitive behavior therapy, wherein you change the negative thoughts. Check how the child is speaking. Check how the child is, what type of language the child is speaking, negative or positive, which is the dominating words which the child would be speaking. Tap those and try to change the negative statements or the negative beliefs that the child has into positive. So I have given here some examples, like how you could use the CBT, that is cognitive behavior therapy, wherein the child is saying that I don't like my parents because they are going through divorce and they are going through separation and they are fighting with each other. I don't like them. So I don't want to stay with my parents. So now you as a counselor has to make them to understand that your parents are your life. Your parents are part of you. You cannot be separated from them. And you need to make them to understand that if a parent is bad, doesn't mean to say if they are going through separation or they are going through divorce, that you're not responsible for that. And they cannot be called bad parents. They are going through some trauma because they are not able to manage their life. So of course, such type of parents have to go and talk to counselors and try to help to build up their marital relationship. Next is trauma-focused cognitive behavior therapy. It is called TF or CBT. Here you are trying to tap on the traumatic experiences that the child is witnessing. So look at the abuse, look at the family violence, or look at the neglect which is in the family environment, where the child is just shunned out of the house, she is thrown out. There are cases which has come to me wherein the child was, every night the father comes drunk and the child is thrown out of the house, and door is locked and the child is sleeping in the balcony. Whole night the child is sleeping in the balcony, and the mother is saying that if I bring the child inside, then there's a big trauma, there's a big havoc, everybody gets beating. So then we have called this type of parents, taken it in writing from them that this type of problem will not be continued, or else the matter will be reported to police. So some help, some action needs to be taken as a counselor. When you become a child counselor, then you have to take care of this type of situations, because they become trauma. So you'll have to deal with the child and do cognitive behavior therapy by focusing on the traumatic experiences that the child has gone through, and help the child to talk about it, to deal with it, to discuss what traumatic experiences he or she has gone through. Alternate therapies are few cases of alternate other type of therapies other than your normal therapies. So which are they? Music is a very, very good type of a therapy which children can use. You can use on children or adolescents, because music is very good for anybody. Now, when you play the music, the child's mind goes onto the music and able to speak up the traumatic experiences he or she is going through. Make the child aware, mindfulness therapy, where you make the child aware of the problems he's encountering, of the mental state, what is happening in his life is interfering with his physical bodies, and as a result of which he can get into asthma, he can get into very severe problems, like diabetes at an early stage, hypertension at an early stage. So the child needs to be made aware. So make the individual mindful that you have to deal with your problems and learn to come out of the problems that you have encountered. So movement therapy, dance therapy, music therapy are other ways of what they are called as alternate therapies, which we can use in order to help these children who have gone through trauma or who are not able to discuss or talk about their life. So how does child counseling work? The child is brought to the therapy session by the counselor or by the parents or whoever is living with the child, and then his milestones are affected. Milestones means from birth till this age, what the child is going through, his milestones are he's not been able to cross all his milestones. He's denied of so many privileges, not allowed to play or put into the closed room, lock the door. So many traumatic experiences the child has gone through. Now, as a counselor, you'll have to discuss this individually and let the parents also know what type of problems are going to affect the child's growing up stages, so that the child will not suffer, he'll be more comfortable in discussing. So step one is that the individual a counselor has to build a rapport and take confidence of the child, where the child has to be very confident that he's speaking to a professional who will keep all the matter in a confidential manner, will not disclose anything to the parents. Then only the child will be able to open up to you and let you know what the child is going through. And slowly, with the permission of the child, you will have to deal with the issues and let the parents know. So what are the signs that you can see that a child is in need of counseling? So you will see that the child is very aggressive, is very rebellious, he suddenly gets angry and his anger is has no control. Then there are sudden temper tantrums. Then the individual, this type of children also face difficulty in reading, writing, maths. They do not get good grades. They are bedwetting, they are having nightmares, they have sleeping, they don't want to sleep alone, they get fearful dreams. Now, dream analysis is also very, very important, wherein you make the child to look at the repeated dream and make the individual talk about who are the main targets of the dream, who are coming repeatedly in his dream and harassing him. So he needs to talk to the main people, whoever are coming in his dream, in a Gestalt therapy session, not in a real encounter, but in a Gestalt therapy session, you can do this, and wherein the child will be able to get rid of the dreams which are harassing or which are negative or which are traumatic, because there are a lot of cases which has come wherein the dreams are quite traumatic. They can see skeletons in their dreams. They can see snakes attacking them in their dreams, wherein the snake tells, when they interact, they get to know that I want to kill you, I want to take your life. So dream analysis is one very good therapy which you can help the individual to deal with this type of experiences. Then you will also see that there is observable loss or increased weight. Either the person puts overweight or either the person is losing weight. And then there are withdrawals in their behavior. What is the benefit of child counseling? He can articulate his thoughts and his behavior. So once he comes and talks to the counselor, finds so many answers to his problems or to the questions which he or she has in his mind, then you are teaching the individual to articulate, to combine the two, and to try to deal with his life in a positive manner. So you are enhancing the individual's positive emotions and help the individual to focus and to look back on the positive emotions and to ignore or not pay attention to the negative emotions that the individual is suffering from. And then you help in this manner, the child will be able to develop academic progress. He will progress, he will improve his grades. He or she will perform well in school. He will start doing very well, and also he will think about his future career and to make himself into any professions whichever he likes. Okay, so here you need to make the parents understand that the child is suffering and what are the sufferings of the child, not telling the hidden things. The child is telling you not to tell certain things, then you have not to tell, but certain things you need to tell, like when the child is being put out of the house and they latch the door and the child is sleeping out in the balcony whole night, then this type of situations you have to take care. Then if the child is not given food and there is differences between one child and other child, then you need to take care, you need to intervene, you need to call the parents and discuss with the parents and let the individual know, parents know, that this is your own child, this is not belonging to somebody else. So do not let your child be disturbed or mentally traumatized in this manner. So what is the importance of the counseling in child development? There are 4 areas. Physical development, the child's growth will be affected. He'll not be able to grow systematically or perfectly. He will be having a stunted growth. That is because his emotions are affected. That is because his growing up stage, there is so much of trauma in the house. So his physical development will be affected. Cognitive development, his mental state will not be good. He'll not be able to think, plan, reason, take decisions. He'll not be able to work in teams. Overall, his cognitive development will be affected. Social development, he'll not be able to move out of the house. Such type of children want to be lonely children. They want to close the doors and stay inside. They just want to play with themselves, put the TV on and play alone. They do not want to go out because they are not happy. So what will they go and do outside? When other children share or talk to them, they will not have anything to say because they are suffering. So their social development is affected. Then their emotional development is affected. Like anytime they will have burst of anger, they'll not be able to speak in a healthy manner. They have a lot of fears, and because of which they cannot even trust anybody. Now, how to help these children with these important factors is like, most important is that we have to help the child to develop trust. Then this type of children, you will see that they're hyperactive. So you need to involve them, keep them busy, give them lots of jobs to do so that their schedule is tight, either drawing, either some homework, either some type of small craft making, or teach them some creativity, or make them responsible of some small groups. I mean, ask them to do role plays, ask them to come up with a singing competition, anything wherein they are going to be busy, because they are basically hyperactive children. Why they became hyperactive? Because they are attention seeking. They are not getting attention in their own home. They are rejected children. So when they come out, they are very hyperactive. And attention issues, they are not able to keep their attention at one place. In one class or one lecture, they cannot sit. They are vagabonds. They are roaming in the whole class, or they disturb the teacher, or they disturb other children. Okay, that is because they are not getting attention in their own home. So I had this type of a case wherein the child is to come and disturb everybody, entire class. So the principal was called that this child is, it was from some other school, and they had referred this case to me. And when the parent came to the child, I asked, when the parent came to meet me along with the child, I asked the mother that how many children you got. So she said, I got only one daughter. And then I said, what is your, where are you working? She says, I'm a housewife. And then she said, only my husband works. But when my child comes from school, she will come and she will tell me everything that has happened in the school. And what is your reaction? I asked her, how do you react with the child? I tell her, please shut your mouth, go in your room, and either you study or either you play with yourself. Don't come and eat my head. Do not tell me all your things, whatever has happened. I'm not interested, because I have to manage the house, I have to manage the cooking, I have to manage everything and take care of you and all your needs. So I do not have time for you. I said, exactly. So the problem here is the mother, wherein the mother has no time for the child at all. And then she expects that the child will be good in her behavior. And then she complains that every now and then the teachers are calling me and telling me this child is not listening or she's giving so much of trouble. I said, it is but natural. So you give at least 15 minutes and just be that 15 minutes with the child, or half an hour, just play with the child for that little time. And when the child will understand, okay, that my mother is interested in me, my mother is concerned about me, automatically every other behavior will fall in place. And after which there was no complaint. So attention issues are also coming because of such type of neglect from the parents. Now developmental delays, which I already told you all, that their child is not able to cross all his milestones. So challenges faced by child counseling, in counseling session, the counselor will face certain challenges. First and foremost, the counselor needs to make the child aware of why you come over here, why you need counseling session, why you're being referred for a counseling. So you need to make the child understand that by building rapport, you have to, as a counselor, you have to let the child know that the child is important for you. Okay, and that whatever the session is going on, that nothing will be disclosed out of the room. Everything will be maintained. Confidentiality will be maintained. Parents will not be informed about anything that has happened in the counseling session. Then only the child will have confidence and open up to you. Unless and until you give them confidence, they will not open up, because they will feel that now I'm brought near one more policeman. They feel that teachers, like parents come and complain, this one is not doing anything, not doing. So teachers become like one police. Then you will become another police, who will be only brought to scold a child, tell all the complaints about the child. That's why when the child is being referred to the counselor should keep only the child with himself and take away the parents or the teachers or whoever has referred the child. Keep the child's attention intact throughout the session. See what the child is doing. Be with the child. You do not, in the counseling session, you cannot tell the child, you draw your home and show me. And besides the other side, you do something else. This will not work. As a counselor, the counselor has to keep constant attention on the child. What is happening in the counseling session? How the child is reacting? When the child is drawing or she's given some activity to do, how she or he is behaving. That all the counselor needs to keep a check on. Because if you do not do that, then the child will be lost. He'll go again in his own world, and the counseling session will not benefit. So as a counselor, you have a great responsibility. You have a great role. Okay, so my session is getting over here. So according to Venugopal Acharya, he says childhood is the best of all the seasons of a human being's life. And the longer the childhood stage was happy, you make him happy during his childhood stage, those memories remain longer lasting, and they bring a lot of happiness to the individual, which will help the child to become more stronger emotionally as an adult. He will have a stable personality. He or she will know how to manage his life as an adult. Or else at the adolescent stage and adulthood stage, he will encounter n number of problems, including mental illness. Mental illness like unipolar depression, bipolar, all this type of mood disorders he can get into, starting with depression. He'll not be able to manage his life, and even he can get into other kind of serious mental illnesses. Thank you.
Thank you so much, ma'am, for sharing your knowledge with us on this important topic.
I think I have been
So-
very fast. I thought that I may take too much of time, and so I was little rushing through.
No problems. Very interesting topic. And I'm sure that all those who are attending this webinar, they will get to know what's the nature of job of counseling psychologists. So accordingly, they can check their profile and enter in the field of counseling psychology. But for
Yes,
that, they
sir.
will have to undergo training program like BA in psychology or BSc in psychology, then
Yes.
MSc in psychology. They can take counseling psychology as a specialization at master's level. Yes. So thank you very much, Dr. Preda. Yeah.
Yes.
So there are some questions for you, but then we'll take it after Dr. Anjana's presentation.
Okay, sir.
Okay.
Yes.
Thank you.
Yeah.
Yes. Okay. Now I would like to invite our next speaker, Dr. Anjana. Dr. Anjana is again an academician, and she's working with working in Department of Psychology, Tripura University. She have years of experience in the field of psychology. Here she'll be talking about mostly- Here she'll be talking about military psychology, what is military psychology, and how and what the career in military psychology will look like. So
This,
handing over the presentation to you.
and Priyanka.
Yes, am I audible and visible?
Yes, yes, ma'am, you're audible and visible clearly.
And PPT?
Yes, ma'am, PPT is visible too.
Namaste and good afternoon to all of you present in this webinar. Respected Gautam Gawali sir, esteemed speakers of this webinar, and my dear participants. At first, I would like to express my sincere gratitude to Gautam sir for giving me this wonderful opportunity to enrich my knowledge by listening to all the esteemed speakers. And also it's my privilege to share my ideas with you all. Basically, the area on which I would like to discuss today is careers in military psychology. I think you have gone through many discussions on different areas of psychologies, what are the different career options in different fields of psychology. And now I'll be talking about different career options in military psychology. Basically, psychology is a diverse field that includes various specializations to address the distinct needs of individuals and communities. With the changes of our life, our lifestyle and surrounding environments, we have realized the importance of psychology in every sphere of our life, in every domain of our life, and of course, in every occupation. And the military force is also not an exception in this case. Now, in my presentation, I'll briefly talk about what is military psychology is, what is the role of military psychology, psychologists, what is the importance of military psychologists by highlighting the different problems, mental health issues faced by the military personnel, and what are the career options in military psychology, and last but not the least, that what are the institutions which provide courses in military psychology. So basically, military psychology is a special field of psychology, which is basically designed or which is basically apply its psychological principles and theory in the military context. We can say that it's a complex and specialized field where the knowledge of psychology is being utilized for the mental health and well-being of the military personnel, or as a whole for the welfare of military personnel, veterinary people, and the family members of the military personnel. Military psychology plays a very critical and crucial role in the selection, training, and strategic planning of military operations. Now, you can ask me a question that what is the main focus of military psychology? The answer is that the primary emphasis or primary focus of applied military psychology is as I said, that enhancing mental health and well-being of military person is basically a special field which is basically concerned with the military personnel and their family members by helping or providing counseling and treatment to the military members or military personnel in the military forces and their family members to improve their quality of life. Now one can basically ask again that what is the need of application of psychological principles in the military force, when we know that military people are so much disciplined, they are organized, they are tough in nature, they have lots of more tolerance in comparison to quote unquote civilians, and they have the more adjustment capacities because they can stay in extreme situations also, they can adjust in any situation also. Then what is the need of psychology in the field of military forces? The answer will be yes, definitely. They are organized, they are more disciplined, they have more adjustment capacity, but at the end of the day they are human beings, so they have emotions, they also have emotional tension, they also face stress and strain, and moreover, more importantly, they not only face war outside themselves, like war with the outside people, war with the enemies, but at the same time they face always a war within themselves, a fight with their own self, a tassel with their own mind, with their own, the job, with their job profile. So let us have a look into different factors or different issues which basically creates mental health problems among the military personnel and their family members. So the first one is that they deals with the violence. Basically, their job profile, basically their nature of job is such type of nature is that they basically deals with the violence in comparison to other occupation. They mainly deals with the violence. They mainly deals with the deals. We can say that they more deals with the bloods. They have extreme pressure on over time. They deals with the death, not only death of enemies, but also death of near and dear friends, death of their colleagues, or even they have experienced near death bala experience. They live in a constant danger. This is a profession which basically compels them to stay in such a situation which is very dangerous in comparison to other occupations. If I give my own example, I am a teacher. Okay, so I don't feel anxious, or I don't feel any hesitation to go to my classroom thinking that one of my students can come with a knife and he or she can harm me or hurt me. There is no such thought. But if I give an example of a military person, whether this is Indian Army or a person in military paramilitary forces, or maybe a person in state armed forces, they basically live in a constant dangerous situation. Whenever there is any emergency, whenever there is any insurgency situation, or whenever there any disaster, they are the first 10 people who basically come forward and rescue us from the danger, making their life in danger. So these are the situations which create lots of emotional turmoils into them. And there is also, they also often feel that they sacrifice their life. They do lots of, adjustments for making their nation safe, or making their citizens safe from the enemies. But often they face negative public opinion, and there is a feeling that nothing, although they do lots of effort, but then also cannot make much difference in the society. They live in extreme temperature. This is a picture of Siachen border, where the temperature drops up to minus 50 to 60 degrees Celsius. So think about the situation, minus 50 degrees Celsius. I think I cannot survive even a single day into such a situation. But they are not only surviving, they are doing their hard work. They are basically protecting us from the enemies. So living in such extreme weather, whether that is a very extreme hot weather or extreme cold weather, basically puts its footprint on the mind of the military personnel and creates lots of emotional and mental turmoil into them. These are some other factors which basically leads to mental health issues among the military personnel. This has been jotted down from my personal experience with dealing with different armed personnel, particularly CRPF, BSF, who are posted in Tripura, and particularly Tripura State Rifle, which is named as TSR. I have been working with TSR department and CRPF and BSF in Tripura for the last 4-5 years, particularly in engaging in psychoeducation. So whenever I get a chance to interact with them and have an interaction with them and came to know about different their problems and the issues which create stress among themselves. So I have jotted down these factors. Non-grant of leaves. Yes, this is an issue which most of the armed personnel has reported that, even they are in their family are in crisis, even there is extreme family emergency, then also their leaves are not being sanctioned by the higher authority when there is any emergency in the camps or nearby areas or in the state where they are deputed. So non-grants of leaves is such a factor which creates lots of stress, and not only stress among themselves, but also stress among the family members, and they suffer from family problems and relationship issues because they cannot support their family members, or they cannot be there with their family members when their family is in need of them, as their leaves are not being sanctioned. So this is an important factor. They live with very inadequate resources, as well as insufficient accommodation is there. Frequent dislocation is also another factor which is responsible for extreme stress among armed personnel. Excessive engagement. They need to be engaged all the time. 24/7 hours is their duty, and there is no, there is no so-called weekend in their profession. They have to be physically alert, they have to be mentally alert all the time, which is resulting lack of sleep and rest. And when there is lack of sufficient sleep and rest is there, then you can understand that physical fatigue will lead to mental fatigue and the stress, mental strain and stress. They often face humiliation by their seniors, and often some tussles or conflict with seniors as well as subordinates. And there is recreational facilities. See, for other professions, we have Saturdays, Sundays, or other holidays where we can enjoy, where we can hang out with friends and go for a outdoor activity. We can go for, dinner or lunch with our friends and the family members. Even we can go for a short trip for 2-3 days or a long family vacation. But if comes to this profession, particularly military people in the military forces, they are not basically can go for weekend wala vacations, because until unless their leave is not grant sanctioned, they cannot leave their camp also. I have seen that while dealing with TSR people in Tripura, I have seen that even their house is just 5 or 6 kilometers away from the camp. Then also they are not allowed to visit their homes frequently without proper sanction of their leaves. So they have what type of recreation they have? They have only some outdoor games facilities, some indoor games facilities, along with one TV in a room where they can see movies or some other things with their colleagues over there. So lack of recreational facilities is also there, and also some of them reported that lack of fairness and transparency in posting and promotion, which all those factors are basically leading to extreme stress, burnout among themselves, extreme anxiety among themselves. They feel depressed, and feeling of loneliness definitely is there. And these all factors are basically resulting different mental health problems like post-traumatic stress disorder, major depressive disorder, anxiety disorder, bipolar disorder, panic disorder, and obviously adjustment disorder. See, whenever any military person or armed person has any injury or wound due to one or other factor, that can be taken care of by someone, because that is visible. But what about that invisible wound? What about that mental pain? What about that mental agony, which cannot be seen by outside? So if all those unseen fears, unspoken pains, and unseen scares of the mind cannot be dealt properly, cannot be taken care of properly, then what will happen? That they may take the lethal step of committing suicide, or they may have the homicidal behavior. Am I audible and visible?
Yes, yes,
Yes,
Dr.
ma'am,
Sujana.
yeah.
Yes, go ahead. Go ahead.
PPT is also visible?
Yes, yes.
Okay, thank you. So if we talk about suicide, basically, this a single report, there are many reports. Due to scarcity of time, I'm not able to show all those reports. So I'm just giving one single report, which itself is speaking about the alarming situation and the importance of importance of application of psychology in military forces. That this report is basically a newspaper cutout. This has been this has been like ये हुआ था कि 23rd March 2021 में published हुआ था, and according to this report 787 suicides reported in armed forces since 2014 up to 2021. This is up to March 22nd 2021. So you can imagine that within 7 years, 2014 to 2021, 7 years, how many suicide cases? 787 suicide cases. That means if I calculate per year, what is the figure? It's more than 112 suicide cases in armed persons, armed forces per year. What is, if I again calculate per month, what is the figure? It's around more than 9 persons has killed their life per month in the last few years. So this figure actually speaks about the alarming situation, about the alarming mental health situation in the armed personnel, which speaks again the importance of military psychology in the field of in military forces. So in such a situation, when military personnel are having lots of emotional issues, lots of mental strain and stress, the military psychologist basically helps, or that there is a role of military psychology, which basically helps the military personnel to overcome their mental health issues, to overcome their stress, to overcome their maladjustment issues. And how they can help? They help them by providing counseling, therapy, guidance, and at times conducting psychometric assessment. Not only this, the military psychologists basically provide training and psychoeducational program for the military personnel, for the veteran personnel, as well as the family members of military personnel. And the topics are such as stress management, time management, prevention of suicide, prevention of drug abuse, etc. So if one asks that what is the role of military psychologist in military forces, that is basically many-folded. Basically starting from selection of right person for the right job. This is very important. This is an important sector where military psychologists play a very significant role. Military psychologists also play a very significant role in enhancing the work performance and efficacy of the military personnel. They are engaged in providing training program, as I have mentioned already. They help the military personnel and their family members to deal with their personal as well as family maladjustment issues and help them to adjust more effectively with themselves as well as their family issues. And finally, they also help the military personnel to enhance their social relation by working on their, or by helping them to develop more interpersonal as well as interpersonal skills. Now coming to what are the careers in military psychology. As I said in the beginning that, our life has been changed a lot, and as well as our surrounding has also changed a lot. So with the changing nature of the welfare, the role of military psychology has expanded many-folded. So this has been, here it has been shown a military psychology career path, where a military as students study after passing military psychology can join armed mental health specialist, can act as an armed mental health specialist, can join Air Force or Indian Navy or maybe Indian Army and act as a psychologist over there. He or she can act as a military psychologist, he or she can act as a military counselor as well as military family counselor. So after pursuing masters in military psychology, one can join military or armed hospital as a counselor, as a psychotherapist, as a clinical psychologist. As I mentioned, if somebody is interested in research, then they can join different government organizations like DIPR. They can also join, if they are interested in teaching, they can opt the teaching professions also by joining colleges and universities, which are basically running the courses in military psychology. Besides, there are some other options also, like in Indian Navy has established many mental health centers in different parts of the of India, like Mumbai, Goa, Visakhapatnam, Kochi, Port Blair, etc., where one student after passing masters in military psychology can join there as a counselor or as a therapist. Even counseling is an intrinsic component of psychiatric center of army. So wherever there is a psychiatric center in the army base camp or army hospital, there is a position of, or there is a scope of counselors also. So in that way, we can say that military psychologists can hold position in a wide range of settings, starting from clinical, starting from military hospitals to military bases to
Sorry,
military
excuse, yeah,
schools and so on.
Excuse me, Dr. Anjana. I think we'll have to conclude in another 1 or 2 minutes, please.
Yeah, yes, sir.
Thank
I'm
you.
in my end of my session only.
Okay,
So
thank you.
with yeah, so with this we can say that military psychologists also not only not only confined in all those areas which I have mentioned, they can also find employment in private practice setting. They can also find employment in legal setting where a military person may be in conflict with crime, or maybe they are the victim of crime, or they can join the rehabilitation setting also. So these are the institutions which are providing master's course in military psychology, like MIT University is providing, Bharatiya University is providing, and for both the universities, what is the eligibility criteria? That is graduation in psychology. And apart from these two universities, National School of Leadership is also providing 3 months certificated course, and for that eligibility criteria is 16 years. So anyone who is 16 years and above can go and join this course. So I must conclude by saying that if one is interested in psychology and would like to work with active armed personnel, veterans and their family members, then careers in military psychology may be the best option for him or her. So with this, my salute to the Indian Army people, my salute to the military persons, and my best wishes to the upcoming budding psychologists. Thank you so much, and Jai Hind.
Thank you. Thank you, Dr. Anjana. It's a wonderful session, yes. And I think all there is super. Is Dr. Freda there? Has he left? Dr. Freda?
Yes, I'm there.
Yeah, Dr. Freda, there's one question which has been there on chat box. Question answer. Okay, the question is withdrawal means in social context.
What is that? I say again, sir.
Yeah, the question is, 1 second. I'm just reading that question again. There's a question. Okay, 1 second. Yeah, the question is related to withdrawal. Means withdrawal. Like, say, if we were talking about drug addiction and all. So withdrawal in social context. Okay, so that's a question one of the participants asked. Many questions we already answered. You would like to answer this question?
Okay, withdrawal in social context. So what do you expect me to say? Means how to deal with the person?
Yeah, yes. Yeah, I think that's what this question is not very clear, but this is what one of the participants raised this question.
Okay, so see, now if the person is going through withdrawal,
I will read that question for you. What does withdrawal mean in social context for children concerning substance abuse? Yes.
Okay.
Right.
So withdrawal means they will get tremors. They will not be able to do their normal activities without the consumption of alcohol, because the person is already taking alcohol. Or say for children, adolescents at a younger age, it is beer. So they start with beer. pre-adolescent stage, 11th, 8th, 9th, 10th students, they normally start with beer. And so if they are getting addicted to beer and now they cannot live without it, then they will experience withdrawal symptoms, like they will get shivers, they will get tremors, they will not be able to remember anything what they are studying. So their academics will be affected, their memory will start declining, they'll not be able to perform well mentally, meaning intellectual development will slow down. Okay, because at an early stage they got into substance abuse. Even beer is considered to be part of substance abuse, because an individual below 21, he's not able to take any form of alcohol. So at least he should be 21.
Thank you. Thank you, Dr. Freda. Dr. Dipti, are you there, Dr. Dipti?
Yes, sir.
Dipti, they wanted this thing after MA or master's program in psychology for specifically train themselves in forensic psychology. Okay, so what are the institutes available where they can continue their education in forensic psychology?
There are two main institutes in India where they can continue after completing their masters. One is National Forensic Science University, and
Right.
second is Raksha Shakti University. Both of them offer specific, programs. NFSU programs are more in forensic context, and Raksha Shakti University are more working in criminal rehabilitation kind of programs. So they have these advanced programs.
Wonderful. Thank you so much. Yeah, thank you. And all the other questions have been answered on chat box, and question answers have been okay. So I really express my gratitude to all the participants. They were listening very carefully, and they raised very, very relevant questions related to their career, that why should they enter in the field of psychology. Okay, what are the different institutes available in India, abroad? Yeah. So this, yeah.
Sir, somebody is asking how to become a child psychologist.
Yes, that I already answered this question, because in counseling psychology, once they study counseling psychology, MA, so child development can be part of it. So that
sir, there are also centers like Goa. Also, there is one college which is offering child psychology itself, post graduation in child psychology. Right. So there must be some colleges. Right. There must be some colleges which will be offering child psychology specialization as well. So they have to do their masters in specialization in child psychology.
Right. Okay. Thank you.
In case they don't get counseling they can do, which is jack of all. But in case they want only child,
so they can train first. They should understand the concept of counseling, and then it can be applied to various populations like elderly, family, children, marriage. Okay, these are some sort of intervention strategies will be almost the same. Okay, this is what. Right. So there's one question to Dr. Anjana. The question is like, does AFMC provides course in military psychology? Air Force.
Sir, I think you are the right person to give answer to this question, because you are providing course on military psychology.
They can approach. Whatever that I will see, all the questions cannot be answered here, but they can actually contact this thing. Okay, concerned institute, and get the information, little more information, because here resource persons have given their, whatever their expertise. So exposure, okay, have been given by the concerned resource persons. For details, you can contact various organizations and collect the information. So academic institutes you can contact. Right. So with this, I think we'll have to conclude the session. I must take this opportunity to thank my colleagues in Amit University, Ms. Anjali, for coordinating this program. Our IT team, Mr. Puneet is there. Okay, so thank you, Mr. Puneet, for coordinating this program, long 3 hours program. And all our resource persons, Professor Raju, Professor Dipti, Professor Freda, Professor Anjana, then Professor Shubhankar. Okay, so all they have given their time and interacting with our students. Thank you so much, Professor Yashab Khan from Aligarh. In spite of having eye flu, he could manage to come and deliver the talk. And I could see the feedback given by all of you. It's a wonderful feedback, and we'll be having similar kind of sessions in future too. Thank you. As Aarti, Dr. Aarti from Jammu Kashmir also has joined. I'm very happy to see you, ma'am, here. Okay, thank you so much. Thank you so much. Right. So over to Ms. Anjali.
Yes, sir. So those who still have some questions, you can send your questions to me on my email ID. I'll try to get back to you with the answers.
Okay.
Okay.
So all answers are there recorded. Answers have been given. Okay. If you see
Yes.
that almost all
In case they have
95%
any doubt,
answers have been
yes.
given to their questions. Okay.
Yes.
So thank you. And there are many of our colleagues from different part of this country has joined this webinar. I'm very thankful to all of them. Abhishek from Bangalore. Thanks, Abhishek. Okay.